This isn't going to be a typical presentation. It's kind of a mix between a demo and some training. Hopefully this will be helpful for those of you who are going to be heading out to the field in the next few months. This demonstration is, the goal of this is basically to show you what the EpiInfo viral hemorrhagic fever application can do, what it is capable of, and at least let you know what is in there. To be able to effectively use it, you still need some training beyond this, but that can come ideally in the format of overlapping with the data manager you're replacing in the field and getting a little bit of hands-on training there. So just be aware of that. This will let you know what you can do with it, but really having some time in the field with someone who's been using it is really essential to being able to use this to its maximum potential. So how many people, and as Diana said also, this is going to be very informal. Please stop me and ask questions at any point. How many people have the folder from the link downloaded on their computer? Just give me a show of hands so I know how many people. So for you guys, this is going to be much more interactive. And so part of this is just going to be me showing you how the different parts of the application work. But definitely, if you can, I'm going to be trying to do it in a way that you can kind of follow along and do it yourself on the computer, because it will stick with you much more if you're doing it with me than if you're just watching me point and click on the screen. So everybody should have this folder or some sort of zip folder that you downloaded from the application, from the website. So if you click on that folder, you should get, once you click all the way into the folder, you should see 4 things. And so for future reference, the reason I wanted to go through this together is this application is continuously in development. It's not done. We're constantly making modifications, revisions. We're responding to the needs in the field and changing. Sometimes in a busy period, you could have a new version every day. So if there's a new version and you're in the field, you're going to get sent a link, just like the one you got sent before this presentation, and you're going to download this folder. So this is exactly what you would do to put the new version on your computer. You can either delete what you had on there and replace it, or you can actually just not delete anything, drag and drop these onto your desktop, and it will just replace whatever you had there. So EpiInfo is meant to run off the desktop. It's much simpler if you do that instead of keeping it hidden in a bunch of folders. So in this folder, you just want to click on all 4 things and drag them to your desktop. And that is all you need to do to install the application on your computer. So you'll get 4 things. One says case management, one says lab, one says is a folder that says EpiInfo 7, and one says launch EpiInfo 7 here. The different components of this are, so when you download the application, it has EpiInfo 7 within it. So if you have EpiInfo 7 on your computer, on your EOC computer, just delete it. I think, don't quote me on this, I think we actually have a slightly newer version of EpiInfo 7 packaged in this than has been released to the public, because sometimes we have to change actual EpiInfo to match something that the application needs to do. So whatever you have on your computer, delete regular EpiInfo 7, and then this comes with it inside. So the EpiInfo 7 folder is the same EpiInfo 7 folder you would normally have with EpiInfo 7. Launch EpiInfo 7 is launching regular EpiInfo 7. The 2 on the left, case management and lab, are the application. They're 2 modules. One's the Epi module, which is the one that you would be using, and one is the lab module. We may not go over that one. If we have time at the end, I can briefly show it to you, but that's meant to be used by a field lab to send information to the Epi team and the Epi module. Okay, before we even get into the application, I'm going to go over a couple more logistical things. So I'm going to show you a pathway. If you think you're ever going to use this, write down the pathway or remember it. And hopefully maybe I can write it down and send it out later. It's not too horrible. So in the EpiInfo 7 folder, you have regular EpiInfo 7, and you also have all the files that are running the application. Basically, the application, the way to think about it is it's built on top of EpiInfo 7. So it's using EpiInfo 7 forms, EpiInfo 7 functionality, but then there's a lot built on top of it that does not come in regular EpiInfo 7. So if you click on the EpiInfo 7 folder, you're going to get this, which is similar to what you'd get if you clicked on any EpiInfo7 folder. Then the pathway you want to remember, because I'm going to show you where the database lives, is projects. So EpiInfo7 and then projects, and then go down to VHF. Everything above that is what you get with normal EpiInfo7. VHF is specific to the application. So we did EpiInfo7, projects, and then VHF. And then right now, there's no database in this application. There's no data. So anything you see here needs to remain here. Anything that begins with a base is actually running the application. In a minute, you'll see we'll come back here. Once we create an outbreak and therefore create a database, there's going to be new files here that begin with VHF. Anything that begins with VHF is a database. And so actually, let's go create an outbreak, and then we'll come back here and I'll finish explaining the process. But I wanted to show you where it lives, because if you ever need to send the database to anybody, you would do it by getting files in here. Okay, so everybody click on case management. Just double click. Be patient with it. Sometimes it likes to think. Don't click too many times. Okay, this is the epi module of the viral hemorrhagic fever application. So right now, there's a title that says current projects, and there's nothing there because we have absolutely no data in it. Then there's also this little button over here that says new outbreak. So we're going to create a new outbreak. So click once on new outbreak. If I'm ever going too fast or you can't follow along, let me know. And then this is what you will see when you're setting up a new outbreak. So you only have to do this if you've just arrived in country, or if you're setting up another database within the country, because you can have multiple databases feeding into a central database. So let's call this the TMS. So the first field is the file name. You can't have spaces. So we're just going to call it TMS Ebola outbreak, which will hopefully never happen. And then the second one is the actual title. Once you have an outbreak, then at the top of every screen, you're going to have the title of that outbreak, because in this application, you can actually manage multiple outbreaks at once. So you want to name them something specific. So here I'm going to do TMS Ebola outbreak, but a little prettier. And we'll say the date of outbreak detection. Let's say it happened last week, just to give us a little bit of time. Sorry, the mouse is being really funny. Where did you go? Hopefully on your computer it doesn't do this. So anytime there's a date field in this application, if you just click once in the field, you should get a calendar. So I'm going to make the outbreak have happened at last week's TMS on August 26th. And then those top three things are very important. The next part is not as important, but if you have a standard ID format that has letters and then a dash and then a set of numbers, you can use this. If not, just leave it blank. But let's say that our ID is going to be TMS dash and then a number. And you can select how many numbers you want it to be. You can select, I think it's 2, 3, or 4. We'll leave it at 3. And then let's say here, this is actually set up not just for Ebola, but not all, but a bunch of viral hemorrhagic fevers. These are all the viruses you can pick from. So let's say it's an Ebola Zaire virus, since that's what we're dealing with right now. And I'm going to leave the country as Uganda. You can select the country. By the end of today, DRC and Senegal will be on this list, and there will be a new application for those of you going out to Senegal. But for now, we'll pick Uganda and say this is an outbreak in Uganda. And then you just click OK. And you should now have moved away from the opening screen and have a database set up that has our title, TMS Ebola outbreak, at the top of it. Everybody good right now? Good. Okay. So let's go back. Just minimize this. You don't have to close it. Minimize it. Go back into that EpiInfo7 folder. The bottom of which screen? The setup screen? You mean to click OK? Where's Meredith? Okay. Is Meredith still here? No, she ran away. Okay, she was my audience person. Okay, minimize. Go into the EpiInfo7 folder. Follow that same pathway, projects, VHF. And now you should have, well, right now it's 3 because we're in one of them, but usually it's 2 files that start with VHF and have the name of the outbreak that we created, TMS Ebola outbreak. So you'd normally have the 2 at the bottom. If you are, so there's 2 ways now to use this database, or to use this application. You can be using it on just one computer, in which case only one person can be entering data at a time. You kind of have to hand off the database, like passing the baton, to be able to have different people enter on different computers. Or at this point, in at least the 4 first affected countries, we have a couple sites set up with SQL servers. So this process, I'm going to go through two different sets of info flow right now. One is for if you're off a server, and one is if you're on a server. It's a very different scenario. So right now, we're all operating off of a server. If you're operating off of a server, you will have 2 files. You'll have an MDB file, and you'll have a PRJ file, or project file, which is the same you'd have with any EpiInfo database. If you ever need to back up, save, give to someone else the database, give it to them so they can work on it, and you'll stop working on it, you just need to copy these 2 files, ideally put them in a folder with a date and time stamp because you start generating a lot of them, and give them to someone else, and they can now have it. To email it, just a note, you need to put it in a zip folder. So this is where your database lives. It's in those 2 files that start with VHF _, whatever your outbreak name is. Okay, that was, you're operating on one computer. If you're operating on a server, whenever that server was set up, a specific project file was made, and the database got migrated onto the server. So once the database is put onto a server, like right now in Conakry, in Guinea, or in Monrovia, in Liberia, they're operating on a multi-user server. There's only a project file. And you can't send the database this way. I'll show you later. There's another way to do it. But there's only a project file in this folder, and that project file is mostly 1, running the database, and 2, telling the computer the server to link up with. So the method I just showed you for sending or saving or copying the database is specifically for if you're just operating on one computer. Okay. Let's go back to the application. So I'm going to just give you a 2-minute general orientation, and then we're going to go pretty much very in-depth through all the things that this can do. So there are 5 tabs up here that all house a lot of different actions. Your case management tab is where you're going to manage your case line list, your cases, and your case management tab is where you add everything. So even if you're adding contacts, you're adding cases, you're adding source cases, which I'll explain in a second. Every person and link gets added in the case tab. Your contacts tab is where you're going to manage contact tracing, basically. It's where your line list of contacts will exist, and where you're going to be able to input information from the day's contact tracing activities, and where you can print off contact tracing lists in the morning to give to the field teams going out to trace contacts. Your isolated patients list is the application is going to be automatically calculating based on the information you've put in, who, based on what you've put in, should be in an isolation ward, or now as they're calling them, the Ebola treatment units. The analysis is, it gives you some pre-done analysis, which we call the canned analysis. It also lets you do any kind of analysis you want within EpiInfo7. And then the transmission chain is going to basically, using the information you've put in, map a preliminary transmission chain of the outbreak. Okay, so let's create some data. The first thing you have to do to start your outbreak database is you need to add a case. So if you go over here, these buttons on the right-hand side under the search bar are what I call the database level action buttons. So these are buttons that are going to do things to the entire database. So everybody click once on add a case and just wait a second. And this is going to bring up the Uganda viral hemorrhagic fever form. At this point, for every country, there's a slightly different form. It's the same form, but we've had to make certain modifications, like locations in every country are called different things. So it's all the same fields, it's all the same data, but it's modified to fit that country. And I'm not going to go in immense detail into this form. If you had a chance to look over the case form that was sent out beforehand, this is the EpiInfo form version of that. There are a couple things in here that are not on the paper form that is filled out in the field. One of those is this status as of current date field, which you can't enter into. Anything that's grayed out, you can't enter into. There's 2 places in this form where the application asks you, is this person alive or dead? At detection, and then kind of at recovery or death, their final outcome. Based on those, the form's going to calculate what their status is at this point in time. So if you were alive when you were detected, this will fill in with alive. If you then fill in dead for when someone died in the isolation ward, this is going to change to dead. For all statistics of final outcome, this is what is used to calculate that. The other 2 things that are not on your paper form. One, there's this thing called record status. You can ignore it if you want. You can use it if you want. It's meant to help you keep track of, if you're the data manager, how complete your record is. You can check different things complete. There's no case report form. Lab results are pending, and that can help you track things. And then the other thing is your epi case classification. This is generally not on the paper form. Some places will add it, which is fine, but this is meant to be filled out at this point in time because the person entering the data should be looking at all of the data they have and assigning a case definition. In the field, if somebody's added it to the form, often the people filling it out don't actually know the case definition or really know how to use it. And so whoever's entering this should be taking what information they have and assigning a case classification. There's 5 different options. And I'm going to explain those. There's a different case definition a little bit in each country, but there are very standard interpretations in a general sense of the case definition. A suspect case is someone who meets certain clinical criteria, and that varies from country to country. A probable case is someone who meets the clinical criteria, meets the suspect case definition, but also has an epidemiological link to a case. So they've had contact with a known case, they went to the funeral of a known case, something like that. So it's just raising the level of suspicion. A confirmed case is confirmed based on laboratory results. Has to be a positive laboratory result interpreted by the lab as confirmed. And then your 2 other options are not a case. In the context of this application and generally in these outbreaks, not a case means that someone met the suspect or probable case definition and then tested negative. So you can only be not a case, and this is important for the use in the application, if you've actually tested negative, and we no longer have to consider you a case. Excluded is in here because I hate deleting anything from a database, but you need some way to kick someone out of the analysis. If, say, for example, you thought someone was a suspect case, you get more information, they really don't meet the suspect case definition. You really don't want to delete them, but you don't want them to be factored into any case counts. That's what excluded is for. Okay, the rest I'm not going to go into in too much detail. It follows in the exact same order and wording the forms. There's some things that are drop-downs. There's some things that you fill in. There's a lot of things throughout here that are inactivated right now. If you're not familiar with EpiInfo, if there's something that's inactivated, so for example right now, status of patient at the time of this case report, you have 2 options, dead or alive. So if I pick alive, nothing's going to happen. If I pick dead and I hit tab, in EpiInfo to make anything happen, you have to hit tab. If I hit dead and I pick tab, watch these fields, they're going to, if dead, date of death is going to activate. And then you can fill in the date of death. So if there's something you think should be lighting up and letting you enter data and it's not working, make sure you hit tab. Something unique to EpiInfo is that you can't enter, you have to enter an actual date. Back when we were using Excel for this, if you weren't 100% sure of the date of onset, you could put, July / 2012. You can't do that in EpiInfo. So for most of the dates, we have a little estimated checkbox. Whenever there's a pop-up, EpiInfo is trying to tell you something. Please read it. Here it's telling me you select estimated. Please tell me how you estimated this. and then this explain box is going to open up. There's only an explain box for 2 dates because they're the most important dates, date of onset and date of death. And this is to say this person said they got sick 1 week after this person was buried, something like that. So there's some things that are checkboxes. If they're checkboxes like occupation, you can check as many as you want. So this first form, again, I'm not going to go through everything, is your general patient information form. Where did you get sick? How old are you? What's your name? What's your occupation? Case ID, very important. Hopefully each country will have a standardized case ID format. I'm going to make this TMS outbreak TMS-001. So this first case is going to be TMS-001. So actually, let's create a case as we're going through. Sorry. Let's say we have a suspect case. Please make the case ID TMS-001. And then we're going to put in someone's name. It is a TMS outbreak after all. So our first case is Doug. Sorry, Doug. And let's say I'm just going to leave that blank. Male, I got that one. And I'll make him alive, just, to be nice. So I'm not going to fill in anything else but that right now because it would take too long, but we need to create some cases to have some data. So this first page would be your general patient information form. Here on the left, this is usually a 3-page hard copy form. To expand it to a manageable thing in EpiInfo, it actually takes up 6 EpiInfo pages. So your second, if you want to go page to page, you can either be in the last field and hit tab, which will take you to the next page, or you can just click on the page you want over here, which is labeled with what's on it. So everybody click on clinical signs. And always wait a second. So this is asking for your clinical signs. At the top, it's going to carry over the name and the case ID of the patient, so you know who you're working with. So let's say this outbreak started on August 26th. Let's say Doug got sick on the 28th of August. So everybody put in 28th of August for your date of onset. Whoops. And then here you go in and you put whatever symptoms are filled out. On the paper form, your options are yes, no, unknown. On the paper form, those are your actual options. So let's say Doug had a fever, vomiting, diarrhea, and he was really tired. And we'll leave it at that. I'll be nice. So you'd fill out, ideally, everything for your clinical signs. Then let's go to the next page, hospital information. So almost everything is not active right now, everything in gray, because if you weren't hospitalized, we don't need to fill anything out. So let's say that Doug was indeed hospitalized, so click yes. And this first hospitalization question should light up. There's 2 separate questions here. This is one of the things that can get a little confusing on the form, so I'll explain it. This first question is asking you if you are currently in the hospital or if you're currently being admitted to the hospital. The second one is, were you admitted to a hospital or did you go to a health clinic for this illness before this point in time? The top one is the more important one. So if you click yes, it's going to light up and it'll ask you for your date of hospital admission. So let's say that he went over to Emory on the 29th of August. And the health facility, his name was Emory. We'll just and we'll just put in Atlanta. Really important, so remember that isolated patients tab, which is going to keep a list of everybody who is currently in isolation, which can be really helpful to keep track of. That is being calculated on a couple dates. The first one is not the date of hospital admission, but your date of isolation. So is this person in isolation or currently being placed there? Click yes, hit tab, and let's put that his date of isolation was the same as his date of hospitalization, so that was the 29th. It can be different. You'll often have people come into a hospital and nobody realizes they're a suspect case for a day or two. Same for discharge. You can have someone who's discharged from an isolation ward, Ebola treatment unit, but still need medical care. So they're discharged from the isolation unit, but they're discharged to the rest of the hospital. Okay, so we've got our information there. Let's click on to Epi risk factors, the next page. And please, if you have time after this session, again, I'm not going through all the fields, but it's actually really helpful to go through and fill out an entire form just to see how the form works. It would take a little too much time right now. I'm trying to just hit the highlights. But take some time to orient yourself to the EpiInfo form. So there's a bunch of different risk factor questions. We're actually not going to fill them out right now, but did you have contact with another case? If yes, then it starts to collect a lot of information. Did you go to a funeral? If yes, more information. Did you travel before you got sick? This is all before you got sick, in the month, 3 weeks to a month before you got sick. Did you travel outside of your hometown before you got sick? Were you hospitalized for another illness before this? Because a lot of infections can be acquired in hospitals. Did you go to a traditional healer? Okay. Let's go over to, actually, there is one important thing here. Okay, so let's say that, yes, we did have contact with a suspect case or a sick person before becoming ill. So this whole field opens, and it gives you room to put 3 source cases. So actually, stay where you're, don't minimize like I'm doing this, but every once in a while I'm going to link back to a, 1 second. Don't mind what I'm doing right now. I'm going to link back to a PowerPoint every once in a while. Oops. Let me explain what source case is. So these slides will be available after. They're not very elaborate, but there are some really crucial guidance items for using the application in here. First one, this is the terminology that was settled on after much debate. You have a case, which is someone who meets the case definition. If that person got the virus, they got it from someone, the person they got it from is their source case. So whenever I say source case, that's what it means. A contact is someone who had contact of some sort, which we can define later, with a case. This can be direct contact, contact with their body fluids, and they are not sick. By definition, a contact is not sick. But they may develop the illness. They could have gotten the virus, we don't know. So it goes virus goes source case to maybe contact. We don't know if the virus went there. A little twist is if you're a contact, the person that you were exposed to is actually going to be called your source case. Just keep that in mind. So back to the application. And if you notice, I closed out and saved out of this form to get into any patient record, because we're going to keep doing the form that you have open. You just double-click on the line. And anywhere you see it, anywhere you see a line for that patient in the application, you can double-click. So we were on epi risk factors. So yes, Doug had contact with a known case. The name of the source case. So there's going to be a so put in Rachel. Sorry. There's going to be a pop-up that says, "Please remember," and the wording is horrible. I'm sorry. "Please remember to enter the exposure for this case in the case line listing." So don't mind the words. What it's telling you is, you just entered that this person has a source case. Remember that you need to go back and officially link that in the application. Right now, so basically, in order to come up with that transmission chain and know who's a probable case versus a suspect case, you can actually officially put the links between source cases and cases in the application. It doesn't do it automatically from here right now. Eventually, we'll get there. So this is just telling you, please remember to do that. Relation to patient, coworker, village, Atlanta. Was this person dead or alive? She was very alive. And it asks you contact types. These contact types are defined on the hard copy form. Don't worry about them right now. Okay, so we've written down the source case. I do want to put something very important is the date of exposure. So let's say that Doug was exposed to Rachel on what did we say it started? He was exposed on the 26th of August. And it gives you the option to have a range for a start date and an end date. Okay, let's move on to the risk factors and lab testing. So this is just a page that has the last question about risk factors, which is, did you have contact with any of these animals in the previous 3 weeks? And then this last question really doesn't matter for this outbreak, and we've actually taken it off of a couple of the hard copy forms. Did you get bitten by a tick? That's for CCHF, which no, Ebola is not transmitted by ticks. Yes. Yes.
Why are drugs listed?
I think we were just trying to cover everything. And I know for probably some viruses in question, the reservoir is not 100% determined, so it was just a general. That was a decision made a long time ago. But basically trying to come up with any potential animal that might have be carrying some sort of viral hemorrhagic fever virus. Hopefully no birds are doing that. Good question. So I'm going to skip the lab section for the moment. We'll come back to that. Bottom is just who filled out this form. And then if you go over to the patient outcome information page, on the paper form, basically there's 3 pages. 2 pages are everything we just covered. The 3rd page is this patient outcome form. The idea behind the patient outcome form is in previous outbreaks, usually you just collect information at the point a patient is detected. And there's a lack of data or a good way to get outcome information. So this form was developed in conjunction with WHO, MSF, mostly the Uganda Ministry of Health when we started this project. And we all decided to try this experiment where you have a 3rd form that if you have a patient in an Ebola treatment unit is meant to be filled out at the time of death or discharge, not admission. So far, it hasn't been used like that. I think in Liberia they might be using it a little bit like that. Usually you end up getting your outcome information from talking to the treatment unit, getting line lists from them. But in the ideal world, that's how you would use this. So all of your outcome information is here, the date that the information was completed, the final status of the patient, and a bunch of other questions. We won't fill this out right now because Doug's still sick. And so you're not supposed to fill this out until the time of recovery or death. Okay, back to the lab, back to the risk factors and lab testing form. The way you enter lab results, it's a one-to-many relationship. You've got one case, and you can have as many lab results as you want. So this button takes you into the lab form, for which you can have as many copies as you want. The only thing laboratory-specific that is on the case page is this final lab classification, because that's meant to be your overall classification based on all of your lab results for this patient. I am not going to go into these classifications right now. But ideally, a field laboratory will be interpreting their lab results for you and coming up with a classification. All the lab stuff was done with the CDC Viral Special Pathogens branch, so it's a little specific to how they would do a field lab, but it is very usable for any field lab. So click on lab sample entry once, let it think for a minute. And it's going to bring up this lab form. The lab form has 2 pages. So one lab form for one sample has 2 pages. Whenever you click on that button in the case form, it's going to do one of 2 things. If there's no lab sample entered yet for that patient, it's going to bring up a new form. If there's 1 to 10 or however many samples entered for that patient, it's going to bring up the first form, which is important. A lot of people will click on the button and think they have a new form and start entering over the first sample's results. So it's going to bring up the first one. In this case, we had no sample, so it's an empty form. So it puts the patient's information automatically at the top, and then it looks very complicated, but basically most of the information you're going to put is in this sample information page, which should ideally be coming to you on any spreadsheet or results list that the lab is sending. So it's going to say, what's your sample type? Usually it's whole blood or serum, so pick whole blood. If you picked other, if it was saliva or urine, which you'll sometimes see out there, you have to pick other, hit tab, and then you can fill in this other field. Completely ignore this UVRI thing. Again, this was developed initially for Uganda, so there's a couple Uganda-specific things left. That's a very Uganda-specific thing, so just ignore it. Then it's going to ask you for the date the sample's collected. This is really important for lab sample interpretation if it's available. The 2 dates you really need to be able to accurately interpret a lab sample are your date of symptom onset and the date the sample was collected, because the number of days between when you got sick and when your sample was collected will determine how you can interpret your result. So let's say that the date was, I think Doug got sick on, it was either the 28th. So let's say the lab sample was collected on the 29th when he got admitted to Emory. Date tested was the same day, August 29th. This is where, this field lab specimen ID is where you'd put your lab ID number. I'm just putting lab 001. This isn't really important. We'll come back to sample interpretation. So that's all ideally on the list of information the lab is sending to you. Then again, this application is for a lot of different viruses. Right now we're dealing with Ebola Zaire. So you're going to go to this checkbox and click Ebola Zaire. And when you do, this box for Ebola Zaire results is going to light up down below. That's the only other box you need to care about in this outbreak. You can put in results for multiple viruses. So, for example, you might get a lab that's testing for Ebola Zaire and Lassa. So then you'd click on Lassa. Lassa's on the second page, so you can enter results for both. Right now, all the field labs are only running PCR. So you only need to worry about this first box. It gives you room to put 2 different PCR results because often they'll run 2 different PCRs on the same sample. Your drop-down results for your PCR result are positive, negative, indeterminate, or non-applicable. So let's say, let's say it's positive. That's really all you need to put there. And then you'd go up to your sample interpretation. And in this case, confirmed acute basically means you're confirmed and you're viremic. So if you're PCR positive, you're confirmed acute. Just a brief spiel. I said I wasn't going to go into it, but just so you know what the options are. Confirmed acute, you're PCR positive. Confirmed convalescent, PCR negative, but you're antibody positive. And that's oversimplifying it. Negative means you're PCR negative. Indeterminate means the lab actually said this result is indeterminate. We need to rerun it. Negative needs follow-up sample. So if you look up here, remember I said the date of onset and the date of sample collection are really important. Days acute, automatically filled in. It's 1. Doug got sick on the 28th of August, and his sample was collected on the 29th. The day you get sick is day 0, and after that, day 1, 2, 3, 4. So days acute is the difference in days between when you got sick and when your sample was collected. This is really important. Generally, at least the way the CDC labs work, and I think the way most of the field labs are working right now, if you are tested on day 0, 1, or 2 and it's negative, you need a retest on day 3 or later. And this is where I'm saying it's really important to have these 2 dates to be able to interpret your lab results correctly. So if this had been negative, I would still be leaving Doug classified as a suspect case because we need another sample on day 3 or later to be able to actually say it's negative. So that's what the negative needs follow-up is for. Anyways, it was confirmed. The second page, just so you see it, has more viruses on it, carries over all the sample and patient information. And you might need it only for 2 things. 1, there's a place to put a malaria rapid test. Some of the labs are doing a malaria test, positive, negative. And if there's anything that doesn't, there's also a comments section at the bottom of the patient outcome form for the cases. So the case form and the lab form both have a place where you can put anything else that didn't fit in somewhere else. So any comments, like there was not adequate volume for the sample, things like that. Okay, the way you save an epi info, I didn't really show this, is any of the case forms or anything like that, you just click on the X, which is unnerving at first, but you click on the X, it closes and it saves. Usually it'll ask you if you want to save. In the lab form, you've got 2 options. If you click that, you're going to close the whole patient record. If you click back, you're going to go back to the patient form. If you click the X, you're going to go back to the line list. So let's go back to the patient form. Go back, because I want to show you how to then add a second sample. And for final lab classification, we now can fill in that he's a confirmed acute case. If you're first identified as positive on a PCR, you're forever considered a confirmed acute case. If you're first identified as positive based on serology, you're forever considered confirmed convalescent. Anyways, that's another discussion. So we get a second sample. Click on lab sample entry again. And like I said, it takes you, now that there's a sample, it takes you to the first sample. So if we want to edit the first sample, we can go there. If we want to add a second sample, you go up on the left here and you click New Record. So click New Record. And it opens a new record. You can enter a new sample. Just to put a marker here so we have something, let's put in that it's a whole blood sample and that it was collected on August 31st. And that's all I'm going to do right now. Okay, so now I do want to go ahead and actually go back. So go back to the patient record. And I just want to show you, go to that patient outcome page. Just so you see at the bottom, there's a note section there too. Okay, so now to save your record, I'm done editing it for the moment. Just click on the X. It's going to say, do you want to save changes to this record? Click yes. And now you have 1 patient in your line list. The line list is just an abbreviated set of variables that we thought everybody would want to be able to see right away. If you want to see anything else, you double click, you go into the record. Okay, quickly we're going to add a couple more cases so we have some data to play with. So click add a case again. And so we indicated that Rachel was Doug's source case, but we didn't discover her till later, so she's actually case ID TMS002. We're going to put that she's a confirmed case. Sorry, Rachel. And make a record for her. just put in her name for now. I just want to actually create a record. We don't need the data. So just put in the ID, that she's a confirmed case, and her name. The only field on this form that is required, that you cannot save the form without putting it in, is the epi case classification. Everybody should be able to have one of those. Everything else is debatable as to whether you'll have it or not. Okay, so you put in Rachel, close the record, and save it. Click Add a Case again. We're just going to create a couple cases. Make it case ID TMS-003. Let's say this is a suspect case. Sorry, you're getting picked on if I know you. So we'll put Neil in there as a suspect case, and then just save it and close it. And then let's do one more. TMS 004. Let's put a probable case, and we'll put in Meredith Dixon. And then go ahead and save and close. So we have 4 cases. Oh, everybody good there? Okay. So remember earlier when we were entering Doug's information, we said Rachel was his source case. So I'm going to show you, so that was how we add cases. Now I'm going to show you how to add a source case. So remember, everything gets added from here. So click on Doug just once to highlight it. Twice, you open the record. Once, you highlight it. And see up here right now, we're in the show. There's 3 buttons here. These are kind of your viewing options in the case management tab. It says show cases only. That's just to show your line list. Now I want you to click show the one all the way on the right, show source cases. So that's going to bring up what's now an empty list because we haven't entered any source cases for Doug yet. But when you're on show source cases, this is going to be a line list of source cases for the case that you have highlighted above. If you want to add a source case to Doug who's highlighted, you go all the way to the bottom here and you click add source case. And it's going to bring up a list of all the cases in the application. To be a source case, you have to be a case. And so we already know that his source case is Rachel. So we're going to click once on Rachel and then click OK. And then it's going to bring up what we call the relationship box. So between cases, source cases, contacts, there's always 3 pieces of relationship information that are specific to the relationship between the 2 people and not to that person all the time. So one is your date of last contact. By far, it is the most important piece of information on this pop-up. So let's say, I forget what date we put. Oh, no, we did. We put the 26th. So Doug had contact with Rachel on August 26th. And that was the last time he had contact with her. So you're going to put August 26th in the date of last contact. You have, again, an option to put if it's estimated, their coworkers. You can put here, there's a little box here in all these relationship boxes that you can click tentative relationship on the transmission chain. If you don't click this, the arrow between the 2 people will be a solid line. If you click this, the arrow will be a dotted line. If you think that they had contact, but you're not 100% sure. And that definitely happens in the field. And then again, so these contact types that I'm not going to go through, they're just different types of contact you could have had. They're not mutually exclusive. You can fill those out. So they had contact types, well, let's not say that. That's kind of gross. But let's say that they had direct physical contact, contact type number 2. So you've entered your 3 pieces of relationship information. You click OK. And now you have, that's all you needed to do to enter that Rachel is the source case for Doug. If I click up here on Rachel, there's nothing there because we haven't entered a source case. I click back on Doug, you can see this source case. So again, to add a source case, you click Show Source Cases, you click Add Source Case, and then you go through those prompts. If you want to edit, so let's say you wanted to edit Rachel's information in general, you would double-click either up here on her case record or down here on her case record. If you want to edit that relationship information that only exists where we just put it, there's a little chain link right here. Click once on it. It gives you 2 options. You can either edit the link or you can unlink the source case. Unlink the source case, you remove the relationship. Edit the link, if you click that, it'll bring up that box again. It looks a little different. It's the same 3 pieces of information. And you can edit the information. Okay. That's how you add source cases. So actually, hopefully, if we go over here to, hold on, don't mind me for 1 second. I'm just going to go in here and give Rachel a date of onset because we need that for something later. So actually, if you're following along, then go into Rachel's record, double-click, and give her a date of onset of August 26th, and then save the record. The reason I did that is hopefully if I click on transmission chain, there will be 2 boxes now. Rachel with a solid arrow to Doug. The reason I had to put the date of onset in is this is time-based. So if you don't have a date of onset, you won't show up. So the transmission chain is really finicky. If a date is missing, the person won't show up. And if the date is missing for someone that is a crucial piece in the transmission chain, the rest of it won't show up. So it's not a perfect thing right now, but if someone's not showing up, go and make sure you have dates. Okay, back to the case management tab. So we saw how to add source cases. What if I want to add a contact? So now we're going the other way. Source cases is going backwards, contact is going forwards in terms of how the virus is being spread. So let's say that we want to add a contact for Doug. So now we're going to click on the little button here that says show contacts. So now this bottom list, where before it was source cases, which is the people that were giving you the virus, now it says contacts. So it's the people that had contact with you when you were sick. To be a contact, you only care if someone had contact with a case when they were exhibiting symptoms, because you can only spread the virus when you're symptomatic. Same deal, though. To add a contact, you go down here and you click Add Contact. If you click once, it gives you 2 options. Do you want to add a new contact, or do you want to add an existing contact? Because for anybody who's a contact, you only want them to have 1 record in the application. Someone can be a contact of 5 different cases. It happens all the time if you've got multiple cases in a family. Right now, I know there's no existing contacts. We haven't entered any. So I'm going to click I need to add a new contact. And it brings up the contact form. If you saw, actually, hold on, you don't have to cancel, but I'm going to show you something. So since I'm over here, the form we were working off of in terms of the one we're matching in the case form is this paper form that everybody should have gotten in the announcement. That matches the EpiInfo form we were just going through. The contact form is for listing contacts. Basically, there are teams that'll do this. The top is to list, you list contacts by case. So you put the information for the case, and then you're going to go around and talk to the case and the family members and people at the hospital where they were, and you're going to find out everybody who had contact with them when they were sick. So 1 line on this form is 1 person. It's 1 line per contact. That translates then into in the application, when we hit add contact and we said new contact, this form that pops up is all the information in 1 line. So this little form doesn't exist anywhere except for in 1 line on the contact listing form. So we're going to just add some context so again we have some data to play with. So let's add in Big Bird was 1 contact. I don't know. I think Big Bird's a male. I'm not even sure. And 34. Something right now, there's a long line of to-do things that we need to do in the development of this application or in terms of fixing things that are being found in the field. Please make sure you put in an age unit on the contact form or it's going to delete what you put in and you have to go back and enter it. So make sure you put your age unit between years and months. So we'll say Big Bird is 34. These look like they have drop-downs. There's nothing there. Let's put the village as Sesame Street. And I'm not going to worry about the rest. But it's basically asking you location information, things like that. This final outcome part at the bottom is grayed out. You can't enter that. There's basically going to be 3 options for an outcome for a contact in contact tracing. You're either going to get discharged from follow-up, meaning that well, let me back up. Contact tracing. Most of you probably know this at this point. The point of contact tracing, it's one of the best ways to stop an outbreak. What you do is you go through, you list all the contacts for a case, anybody they had contact with when they were sick that you can find, and then the goal is to then check in with them in person every day for 21 days. 21 days is your maximum incubation period for Ebola. And so the date of last contact with the case is day 0, and then for 21 days after that, they're trying to get teams out to the field to check in with them. Usually the contacts then, first you list them by case, they then get grouped by location, and you'll have teams going to different locations to check in with these contacts. So 3 outcomes. If you finish your 21 days and you've been healthy the whole time, you end up being discharged from follow-up. These get filled in automatically by the application. You'll see it a bit later, based on what you're putting into it. Developed symptoms and isolated or died means you developed symptoms and you were isolated or you died. So you became a case, basically. Dropped from follow-up means that a contact was the contact, and we'll go through this again. The contact was the contact of a case, and only one case, who ended up testing negative for Ebola. So we no longer need to follow them as a contact, so this person gets dropped. We'll go through that more. Anyways, we are adding Big Bird as a contact for Doug. You click Save, you get the relationship box again. What was the date of last contact? Let's say it was August 31st. And I'm just going to put that they're friends. And then you click Save, and you have a contact. So basically similar steps to adding a source case. Let's add a couple more contacts just to, again, have some data. So click Add a contact again, and click New Contact. And we're just going to put Bert, male, put Atlanta in the village. Oh, no, sorry, it was Sesame Street. And save. And pick a date of last contact. Let's say it's August 30th. And save. And now you've got 2 contacts. Let's do one more for Doug. So add a contact, add a new contact, and let's put in Ernie. I've done this so many times I've run out of names for people. Sesame Street. So we've got Ernie, who's male and lives in Sesame Street, on Sesame Street. Click Save, pick a date of last contact. Let's say it was yesterday, September 1st, and save. So now there's 3 contacts that have been listed for Doug. Okay, we're going to add a few more, again, just so we have some data to play with. So let's click on Rachel and add a contact. Add a new contact, because it's a new one. And let's say it's D-Frog Kermit. And I don't know where he lives. So let's just say he lives in Atlanta. No? Well, yeah, okay. One note when you're putting this contact information in, it's really important to spell locations consistently right now, because eventually these locations are going to be what the application is using to sort people into lists by location. So if you spelled Atlanta 2 different ways, if you spelled it wrong somewhere, it's going to be read as 2 different places. So make sure you're spelling right. Atlanta, and then let's click Save. And we'll put a date of last contact as August 31st, and save. The other information is important. At this point, I'm just filling in the information we need to be able to demonstrate parts of the application. I'm not advocating for skipping fields. Okay, so we've highlighted Rachel, right? And we added a contact to her. Now click once on Add Contact, and let's say we're going to add an existing contact, just so you see how that works. So I think we had Big Bird. So Big Bird also had contact with Rachel. And we know that Big Bird is in the application already. Actually, back up a second. We'll get to the Contacts tab in a minute, but if you see there's a search bar at the top of the Case tab, if you click on this Contacts tab, there's also a search bar here. Everybody we've added in as a contact to anybody is listed here in a contacts line list right now. So in this application, anytime you're going to add a case or anytime you're going to add a contact, please go to the Contacts tab and search to see if they exist as a contact. Because if they exist as a contact, if you're adding a case, you're going to actually convert them to a case. You're not going to create a new record. They have a record as a contact. You're going to convert them over. If they're a contact, then you know you need to add an existing contact and not a new one, or you're going to end up with a duplicate record. So if I didn't know if Big Bird was in here, the search bar, you can only do one word. And it's like a real-time search. As you type, it's going to search. You can't do a word space a word. Right now it's just one word. So I'm going to put in big. And Big Bird pops up because that's the only one with big in it. So then and to unsearch, you need to delete what's there. So I now know, because in theory there could be a list of 3,000 contacts, that Big Bird exists as a contact. So just make it a habit to always search before you add anything to see if they're in the system already as a contact. So Big Bird was a contact of Rachel, so I'm going to click once on Add Contact, and then click Existing Contact, because Big Bird's in the system already. And then it's going to give me a list of all the contacts. I can search, since there may be thousands of contacts in here, but I see Big Bird. I'm going to click once on Big Bird and click OK. So it's similar to adding a source case. And then it just asks you again for your relationship information. So Big Bird had contact with Rachel on August 29th. And click OK. And so now, if you highlight Rachel, she's got Kermit and Big Bird listed as contacts. If you go to your Contacts tab, Big Bird's still only listed once. And we'll get here in a minute. I'm jumping ahead a little bit, but if you clicked on Big Bird and I wanted to see show source cases for Big Bird, it lists Doug and Rachel. So it's the same sort of relationship information on the Contacts tab as on the Case tab. So back to the Case tab. Let's add a couple contacts for Neil. So add contact, add new contact. I'm lacking here. Let's see. My brain's not working. What? Thank you. Thank you. Oh, wait. Which one's the first name? We'll say Bob is the other name and Sponge is the surname. SpongeBob. Okay, good one. Save. Add the relationship information. We'll put the date of last contact as today, September 2nd. And save. And we'll give Neil another contact. Let's say add existing contact. Let's say that Bert. So click Bert and click OK. Because Bert had contact with Neil too, and the date of last contact was yesterday, September 1st, and click OK. Okay, I think that's enough data to play with for now. So now we've got 4 cases. If you click on each one, right now I'm on the Show Contacts tab, you can see that there's contacts listed. As you highlight each case, it shows you the contacts for that case. Meredith doesn't have any contacts right now. Same for Show Source Cases. Doug is the only one with a source case. You can kind of arrow down to look through here. Actually, to be technically correct, to be a probable case, Meredith should have a source case. So let's just add a source case for her. Because to be a probable case, by definition, you have a source case. And let's say that Rachel was also her source case. So we click on Rachel, we click OK, we say date of last contact was August 28th. And now Meredith has a source case of Rachel too. So if we went over to our, well, no, we wouldn't see it on the transmission chain because Meredith doesn't have a date of onset. Okay, we've got a case, we've got a line list. We've got cases, we've got contacts. Now we can get to the fun stuff. So any questions about adding source cases, adding contacts, how that works? Yes?
How do you deal with people with the same names?
So for cases, that's why we have a unique case ID. For contacts, it gets a little difficult because it's really hard to start adding a unique case ID to thousands and thousands of contacts. The next thing we usually check, so if there's exact same name, which does happen, look at age, look at location. And usually looking at those 2 things for contacts will help you narrow down that. Sometimes you just don't know. Always default to just creating a new record, and then you can consolidate later if you're not sure. But that definitely becomes a problem. Cases, it shouldn't if you have a really good ID system. Once in DRC, we had 2 cases in the hospital at the same time with the exact same name, and the only difference was one was 5 and one was 55. And so we had to put that on everything. And their case ID. Okay. So we have cases, we have contacts. So remember I said these are the case level action buttons. We'll get back to those. Actually, let's do them now. Just FYI, at the top of each tab, at the top of the case tab or the contacts tab, there's this print case report form. It's going to print just a blank. It'll bring up a PDF of your blank case report form if you need one. Right now, though, that's the one that's default set with Uganda locations. But if you desperately need a case report form, everything else is the same. Same for contacts. If you're in the contacts tab, you've got a contact listing form at the top if you need to access it. Okay, we covered the search bar. We covered add a case. Let's skip to print for a minute. So if you click once on the print button, again, this is dealing with the whole line list. You've got a couple options built in. One day we'll have a modifiable thing. You can pick exactly what you want to print. Right now you have 3 options. One is print all case records. If I hit that, it's going to think. and then it'll bring up an HTML of with a short list of variables, every single case that's in the database. This is if you don't necessarily want to send the database or someone doesn't want the database, but they just want a list of cases. For example, the contact tracing teams. Often in Liberia, every night they're sending a list of all the cases to the contact tracing team so they can cross-check and make sure that they've got contacts for all the cases they should have contacts for. You can just save it and send it. Another option for printing, I won't do it right now, is to print all alive, suspect, and probable cases. These printing options were based on action items that are often needed based on the database. So often, especially in outbreaks right now, you might have cases that are listed as suspect or probable, but they're alive. At the end of an outbreak, in the ideal scenario, which we definitely don't have right now, at the end of an outbreak, every person who remains classified as suspect or probable should be dead. Because if they aren't, you should have gotten a sample on them to test them to see if they're not a case or confirmed. So this is if you're at the point where you have enough resources to try and track those people down, you can print a list of all the people that need samples found. Print confirmed and probable cases without contacts. For most of these outbreaks, I think we're listing contacts for confirmed, probable, and suspect because there's so little information coming in that you don't really know if someone's a suspect or a probable necessarily, and so you need to treat the suspects like probables. Generally, though, you're more concerned about confirmed and probable, so this will tell you which confirmed and probable cases don't have any contacts listed. So you can literally and we were doing this in Guinea every day, these are the cases that need contacts listed. Please go find contacts for them. So these are just some action item buttons. So those are your print options for just an abbreviated list. Export. If you click once on export, you've got 3 options. So the first 2 options are for exporting to Excel. You want to send the database to someone who doesn't have the application. You want to put the data into SAS or somewhere else to do analysis outside of EpiInfo. Those 2 options are the top 2, export for analysis versus export for viewing. The only difference is export for analysis has your variable names at the top. Export for viewing is if you're just sending it to someone, it actually kind of is a little prettier and says what the columns are, and it's a little easier to look at. Has some variables taken out that really aren't needed for viewing, more for analysis. So these would export. So if I clicked on export for viewing, I want to send the database to someone who doesn't have the application, I'm going to get a little save document, a save window. And basically you have to tell it where to save, so I'm going to just say test. I'm going to save it to the desktop. And if I click save and I go to my desktop, whoops, it tells me it was successfully done. The app likes to talk to you a lot. Now there's a little thing here that says test. If I open it, you now have an Excel version, an Excel document with all of your case data in it. And this is everything on the form, so it's all of the case data. Another difference between analysis and viewing is analysis, you'll just have your codes for your variables because there's codes behind all these variables to make analysis in SAS easier. And viewing, it will tell you what the codes mean. So 1 equals confirmed, 2 equals probable. Okay, so that's how you export to Excel. Don't save. Okay. The other export, so now we're going to talk a little bit about sending and merging databases because that's where we are. So if you need to send this database to someone for 2 reasons. So remember before we said if you're just operating on one computer, you're not on a server, only one person can be working with these database files at once, otherwise you're going to create multiple databases. To send the database to someone to work on, view, things like that, you can just copy those 2 files, the MDB and the PRJ files, and send them to someone. If you are on a server, you can't do that because the MDB file no longer exists. The data's on the server. So one reason you might want to export your database in a sync file version, which just means it's a file you can import somewhere else, is if you're on the server and you want to send the database for viewing analysis to someone else. The other reason is right now the way we've got these databases structured in all these countries is there's always at least one central database, usually in the capital of the countries. So I'll use Liberia as an example. In Monrovia, that is the central database for the entire outbreak in the country. It's got data from the entire country in it. But there's also now 2 what I call satellite EpiInfo databases. So there's a database in Lofa County and there's a database in Margibi County because those have a lot of cases. And so they're maintaining a database in those counties just for that county. So at the end of every day, what they're supposed to do is export their database in a sync file, send it to Monrovia where there's a central database so that that database can then import their information. So basically, if you have a satellite database in a county that's just dealing with one county, and you basically the central database is no longer adding in any information for that county. All of the information has to get added in the database for that county. Because what's going to happen is they're going to export their database to you. You're going to import it if you're the central database. And all of their information, the sender's information, is going to overwrite the receiver's information. If you've been in the field, if there's anybody who's here when this was happening, initially you could only send cases. Now, as of about a week ago, you can send contacts and cases. Just an update for anybody who may have known the old version. As I said, there are continuously new versions coming out as we respond to requests from the field and have more time to develop things. And generally, if we send a new link, we should be sending a little list of what got updated, what changed, if you're one of the data managers in the field. Yeah.
Are there guidelines or rules for assigning case IDs in different parts of a country to avoid creating duplicate case IDs for two different people?
Yeah. So at least every country I've been in for this outbreak, which is Guinea and Liberia. In Guinea, for example, the ID, if it's the same as it was in April, is actually assigned by the data manager. And it's always different. Every country, every outbreak, it's a different format, it's a different system because what works for one country doesn't work for another. In Liberia, what they're doing is they actually pre-number case report forms and send them all over the country. And so there is someone in Monrovia keeping track of what case IDs have been assigned or not. And then if something comes in without a case ID, they can also look and then assign a case ID retrospectively. So yeah, any good case ID system should hopefully have a mechanism to ensure there's no duplicates.
This is actually a contact, but if you enter a contact and then you realize that that contact has already been entered for someone previously, do you have to delete that entire record, or how do you rectify that?
So right now, and this is one of the things at the very top of our to-do list, is to create a merge. Ideally, eventually you want to be able to click on two records and say merge these, and then have something guide you through what you pick. Haven't gotten there yet. Again, hopefully that's one of the next things to happen. Right now, with any duplicates, cases, contacts, anything like that, you need to delete one and put it in. For cases, one way to make it's a pain. I acknowledge that. One way to, and again, we'll get there. With cases, one way to make that a little easier, because there's a lot, a contact's just a little bit of information. Cases, there's a lot you can actually print. I'll show you in a second, a completed form. So you can print a form with the information that's in the database. So even if you have to delete it, you at least have a form to guide you through the reentry. Another reason why you should always go back to the search bar in the contacts tab before you add anything and check to see if someone exists already. Okay, so that was your export. You can export through Excel, or you can oh, wait, sorry, Neil, you had a question too.
Yeah. Satellite site.
Yeah.
If you're the receiver of the file, do you just put it in that projects folder you referred to before to open it up?
No. So I'm about to show you. Getting there right now. So export. If you sent the MDB and the PRJ because you just want to send the whole database, then yeah, you drop them into the folder, and you will. If you go, if you're at this setup page, if you drop. So right now I actually have. Now when we open this, there was nothing here. Once we created an outbreak and now have an MDB in our PRJ, there's this outbreak existing. So if I open the application, I'd see this. I just have to click on it to go into this outbreak, and you can have as many outbreaks as you have couples of MDB PRJ. So if you drop it in, if someone sent me a database right now, I dropped it in, I'd see it just as an outbreak to pick. But that's if you're just sending the whole database. That's not for the merge. For the merge, we've exported a case sync file, and someone basically it's just a file that someone can email to you. So a satellite database sent me, I'm a central database, a case sync file. I go over to import, skip for the first one for a minute, and I say import case sync file. I click it, and it's just going to ask me to find that file. I find the file, I double click, or I click open. I don't have a file to do it with right now, but I basically just say import case sync file. I find the case sync file, and it will magically import everything. So that's how you do it with so there's two ways to send the data. One is the MDB and the PRJ, which is sending the whole database, or your case sync file, which sends the actual importable version, which is that's what's going to happen if you've got satellite databases, because they can send you their whole database in an MDB PRJ just to view, but if you want to incorporate it into your database, you have to have this case sync file. I believe actually there's, don't quote me on this, but I think when you hit export and you export your case, I think there may be a newer version at this point that hasn't been released yet where you can actually choose to export either just cases or cases and contacts. So if you get this in a future version, you might see that there. Okay, any questions about the import? Just a couple clicks. Okay. The other thing, when you clicked import, you saw import lab. So remember there's this lab module that we may or may not get to. It's a very simple module, but basically it's set up so that it's like a satellite database, but it's specifically for the lab. So basically the lab form in the lab database matches exactly the lab form in the epi database. So if you have a lab that you have good enough communication with to make sure this case ID system, you're communicating case IDs, you can have someone entering their lab results directly into the epi info lab module. And instead of having to get an Excel, like usually what happens is labs will enter their results into Excel. They send you an Excel list, and you have to manually enter the lab results. If a lab is using this, they can just send you a sync file, and you can import it, and the lab results will come in. And so there's a couple rules for that too. Because in the lab module, you have also a patient-level form that has a one-to-many relationship with the sample forms. And it's got a couple variables. It's very short, just a couple variables the lab might need, like name, age, date of onset for the patient, which are similar, which have identical values in the epi database. And so if you're sending the lab database, lab information, in terms of what gets sent or overwritten, lab information will, for a sample, the lab will overrule what epi's entered. So if epi's entered sample information and the lab sends sample information, it's going to overwrite it. For the patient information, if epi has like a name and the lab has a name, what's in the epi database is going to rule, because usually they're more up to date. But if the epi didn't have a name and the lab did, it would fill it. The ID system for the lab, again, case IDs have to match. If the lab sends a record with no case ID, the epi system will interpret that as a new case. And so it's looking for these matching IDs. And so actually in Liberia, I think they may actually finally be using the lab module just to enter data into, but we're still not importing it. It's just they were having trouble organizing their data, and the lab module was a way to do it. There's not good enough communication between the lab and the epi team that's doing the database to make sure their IDs match, because this is a little bit more labor intensive. You have to make sure that every case from the lab has an ID in order for them to be able to make this work. Anyways, we can talk more about that later if needed. Probably you won't need to use that unless you're somewhere where there's a CDC lab. Okay, so that covered all your case-level action buttons. Now there's these what I call patient-level action buttons. So there's a wheel next to every single case. If you click once on the wheel, left click, you'll see a bunch of different options that will do things to just the case that you have highlighted. By the way, we're almost to the point where we can take a break. We will shortly. So, 1, delete a case. If you click it, it's going to say, are you sure? Anytime you want to delete something, it's going to ask you like 3 times if you're sure you really want to do it, because once it's gone, it's gone. Are you sure you want to delete this case? It will also tell you any contacts that case has will be deleted. So if you're deleting a case and there's contacts that only are contacts of that case, you're going to be deleting those contacts too, because by definition, you cannot have a contact that does not have a source case. So you want to make sure that, and keep this in mind if you're actually having to fix duplicate records, delete the one that has, usually there's one with contacts added to it and one not. Delete the one that doesn't have contacts added to it. And if I click yes, I do want to delete it, it's going to ask me for a confirmation code. So in the field, you can have a lot of people entering data. Yeah. Mm-hmm. No, and we'll get to that later, but to answer the question is, if you have a contact that's linked to 2 cases, for example, and one of them is a confirmed case and one of them is a suspect case and the suspect tests negative and becomes not a case, the contact will still be followed because it's still linked to a confirmed case. We'll get to, there's a lot of contact tracing scenarios that we're going to get to after a little break. There is a lot of there's a lot of things that happen automatically in this application to try and make the process as efficient as possible for contact tracing, because they're generally things people aren't paying attention to in the field but can save a lot of time. So if you ever delete anything, it asks you for a code. I'll tell you the code. But the reason we have a code is because you can have a lot of people entering data in a country. And some people are more managing the data, and some people might just be entering data, kind of rote, whatever's in front of them they enter. You don't want anybody to be able to delete anything because you'll end up losing a lot of information. So usually it's best to pick a couple people who are, or one who is managing the data. If something needs to be deleted, someone has to call them over and have it deleted. 2468, it's really creative. One day we'll change it because now a lot of people know the code. But it's important to know. I won't delete Doug, though. So that was your first option, delete a case. Then you have print. And if you hover over print, you've got two options. One is to print your full case report form, and one is to print your outcome form. This is what I was referring to earlier. If I click print full case report form, I've got Doug highlighted. It's going to bring up the form in the PDF version, so the one that you're filling out in the field, filled out with the information that's in the database. So you see he's got his name. It's checked that he's alive. If you print you can always print an epi info form, but the problem is if you have a drop down or something like that, you don't see the drop down values. So here you can print out a form filled out with everything in the database. This is great for a couple of reasons. One, you might get 3 forms for one person, which is fine. Something we're trying to really get across in the field is saying we would rather get 3 forms for one person than no form for someone. So if you're not sure if someone has a form, please fill out a form. And invariably you will get different information on the forms. So this is one way to print out one form for a patient based on everything that's been entered for them. It's a way to help you delete and re-enter information. Or if someone's going to go out and there's missing information, you want them to go find information, you can hand them this form so they don't have to fill out a whole form again and just say, please find the missing information. So you just have to save it, and then you can print it directly. You can also print your patient outcome form. Again, this isn't really being used right now because these outbreaks are a little too big to be able to accommodate this. But if you are using your patient outcome form as a discharge form, and there have been outbreaks where the database is located right next to the treatment unit, you could print out pre-filled forms with name and ID for someone who's about to be discharged and ask the MSF or one of the doctors to fill it out for you. Okay, other options for a case. So you can delete, you can print. Let's skip the third one for a second and say show lab records. So as you can see, there's a couple layers of forms you have to go through to enter lab records. So if you just want to go look at something, it's kind of a pain. If you just want to look, you don't need to edit. You can just highlight a case, click show lab records, and it'll show you a little line list of all the lab samples that have been run. The other reason this is here is there's actually no other way to delete a lab record. So if you enter something by mistake, you have to do this to go to the trash can and delete the lab record, in which case you'll get asked again if you really, really want to do it. Okay, the last thing here I skipped over, convert to contact. So there's a lot of scenarios that can happen. We've tried to think of all of them. I'm sure we've missed some. You may have someone who comes to a treatment unit, an Ebola treatment unit, meets the suspect case definition, is admitted to the treatment unit, has a blood sample taken, and it tests negative. So they're not a case. But while they were in the treatment unit, they may have had contact with a confirmed case. Or we had a situation once where a whole family came in together. It was like 5 people, and 3 or 4 of them tested positive, and the other one didn't. So that person obviously had contact with them. In the past, this person would be called not a case and just not thought of, but really they need to be followed as a contact. And again, you want to keep one person with one record in the system. So if this happens, let's say Meredith, who's a probable case, ends up testing negative. But while she was waiting for her lab result in the treatment unit, her bed was right next to a confirmed case, and she might have had some exposure. So we're going to click convert to contact because, I'm going to show you this. I'm going to say convert to contact. It's giving me an error. It says you can only convert patients classified as not a case to contacts, which is true. Because if she's a probable case, she's a case. So I said she tested negative, so I'm going to go into her record. So if you're following along, double-click on Meredith's record. Oh, no, don't do this to me. Don't mind me. When in doubt, close and reopen. Always. Double-click on Meredith's record. Please open. And her form will open. She tested negative. I'm going to change her to not a case. The not a case is you actually tested negative. And I'm going to close and save. So now she's not a case, so now I'm going to try again. Convert to contact. And it should be thinking for a minute. Sorry, I'm just... So what it should have done, and I will figure out later why it didn't, is when you say convert to contact, pretend it does this because it'll be fixed soon. When you say convert to contact, it should ask you what the source case for that contact is. Because, again, you can't have a contact without a source case. So if I'm trying to convert Meredith to a contact, it did before ask me who's the source case for this contact. It gives you a list of cases. You click a case. It asks you the relationship information. It asks you for the date of last contact, and then it will convert that person to a contact. For some reason, it automatically assigned Rachel as her source case. But again, hopefully in the future, we'll have a new version that prompts you to do that, like it did before. And if you see now, so now Meredith has a contact record. And if you look next to her, there's this little double exclamation mark. In the contact record, she's got a record as a contact, and she's got a record as a case. Because she was one, and once you're a case, you stay in the line list. So she's got this double exclamation mark here, too. That's just telling you that this person has a case and is listed as a case and a contact.
It worked for us, Alana.
It did? Okay, good. Because it was working not so long ago. Okay, good. So that's why and how you would convert a case to a contact. I think we have now covered everything in the case tab, and the rest actually goes a lot faster. So any questions about anything that I have gone over so far? Good. So you're all ready to go use the case tab in the field, right? Okay, good. Okay, let's take a 10-minute break, or a 12-minute break. Let's say come back at 10:45, and we'll do the rest of the application. He had a great laugh. Okay, before I start, I heard that there are some participants on the phone line. Does anybody on the phone bridge have any questions about what we covered in the first half?
We're very, very grateful for how you done. So it's,
Okay, I'm going to take that as a no. I'll try and ask again in a little bit. Okay, so you're all case management tab experts. Everything always gets added in the case tab. So now we're going to click on the contacts tab. Oh, and just while I'm looking at it, FYI, there's these 3 buttons up here. If you hit close, it'll take you back to if you want to switch between outbreaks, it'll take you back there. If you hit settings, it'll actually let you edit some of the outbreak setup items. And if you hit refresh, like I said, when in doubt, like close and reopen. Actually, there's a lot of times you might do something and expect like something to show up, a case to show up, something to get inactivated, something like that. If you don't see it, hit refresh, and 99.9% of the time what you thought was supposed to happen will happen once you hit refresh. Okay, contacts tab. So now you've got sub-tabs in the contacts tab. There's 3 sub-tabs. All contacts, which is what we're currently in. Daily follow-ups, prior follow-ups. Forget about it for a minute. We're in the All Contacts tab. Basically, All Contacts tab has a list. It's a line list of all your contacts. Listed once, even if they've got multiple relationships. So just a quick line list. You can print your contact listing form. You can search. Same rules as before. The only database level thing you have is export. If you click once on export, it gives the option to export for analysis. We haven't gotten too fancy with it's again on the to-do list to make a prettier version. But if you want to analyze your contact information, you can export here. The only thing it exports right now is what's actually in the contact form. So that information where you put the contact in. I think it might put in some relationship information. Beyond that, you'll see a lot of contact tracing information. Right now, we don't have a way to export. You'll see what I'm talking about in a minute. All of the daily contact tracing information. That's again, item on the to-do list. It gets pretty complicated. Okay, so you've got your line list of contacts. So the biggest thing for this, one second. Don't follow me. I'm just going to do something to show you an example. Oh, actually not follow, don't do this, you don't have this, but this is a demonstration of moving a database. So I've got a sample database here, de-identified, etc. It's an MDB and a PRJ file. So what I'm doing is I'm going to drop it in to the application. So I'm just going to copy the MD, say no, I got this in a zip file. I'm going to copy the MDB and the PRJ. I'm going to go to my EpiInfo 7 folder, projects, VHF, paste. So now I've got two different outbreaks that begin with VHF. One is the TMS Ebola outbreak. One is the Norland, which is a fictitious place that has an Ebola Zaire outbreak. And then that's it. I just had to drop them in there. Now, if I open the case management module, there's two outbreaks there because I have two databases. So what I want to show you is I'm just going to click on Norland. There's 272 cases in here. And what I wanted to show you is I clicked on the contacts tab. This is an outbreak, a database for an outbreak that has theoretically been going on for a while. And there's a lot of contacts that are gray versus white. So this basically delineates, and I'll define this in a second, active versus inactive contacts. An active contact is white, an inactive contact is gray. Active contact means that they are currently being followed up. Inactive means they're no longer being followed. And that can be for a variety of reasons. Remember, there's three things that can happen to contacts. They can get discharged because they finished their follow-up, fine. They can get sick or die and become a case, or they can be dropped from follow-up because the case that they were linked to tested negative, and it was the only case they were linked to. So every single case here that is gray should actually have that little part of the contact form filled out. So if I double-click on a case that's gray, and wait. Apparently it's a very complicated contact that's gray. Why are we not working? Okay, apparently this database doesn't like me, but we'll see in a minute. All those gray contacts have a outcome. You'll see that in a minute. But so gray versus white was just what I wanted to show you. And right now we only have 6 contacts. In this All Contacts tab, these 3 buttons are similar to what we had in the Case tab. So if I'm clicked on a contact, Big Bird, and I show contacts only, it's the contact line list. If I click Show Source Cases, it will show me the source cases for this contact. And every single contact, if I go down the list, will have source cases because you cannot have a source case list. And then this other option is different. You're not going to have contacts for contacts because that wouldn't make any sense. The other option is actually the Show Individual Report. What that's doing, it's blank right now because there's no information in here, but it's giving you a box for each of the 21 days. And that box, based on the information you're going to be putting in for follow-up, will tell you what happened on that day for that person. So right now, they're all white because there's absolutely no information in there. We'll see in a minute, or let me see if I can find an example for you. Okay, so this is that Norland fake database. Green means they were seen on that day and they were fine. So this person was seen all these days except for these 3, they weren't seen. It's blank. Let's find another interesting one. Okay. Gray with hash marks, and it says what it is, says not seen. So that means that someone tried to find them and then could not find them. So white is there was just nothing written down for this person on that day. Gray is someone noted that they could not find them or they weren't seen. This person got sick. They weren't seen for a while, and then they were noted to be sick and isolated on April 9th. So red will say either 2 things. They're sick and isolated, or they died. And after that, they're no longer followed as a contact, so these never needed to be followed out because they're a case. There's only one other option, which I might not find, which is yellow, which basically says, there we go. I think now it should say sick but not isolated. So there's an option to put down that someone's ill, but someone made the decision they didn't need to be isolated yet. So it's kind of like your warning sign that you need to pay attention to them for the next few days. So that's your individual follow-up report. You can actually print that out. If someone wanted a report for this particular contact, you would go here and click print. And there's no information, but it'll show you the basic information on that person. It'll show you who they had contact with. The date of last contact is going to be the latest date of last contact. This is important for all contact information. If a contact has multiple source cases, it's always going to be calculating everything, your 21 days, everything like that, off of the latest date of last contact, so the person they had contact with last, because you always want to default to following them as late as possible. On that note, there's just something overall, a data management note for these outbreaks. There's 2 dates that are really important that you might have to estimate: date of onset for a case and date of last contact for a contact. For date of onset for a case, if there's different dates and they're within reason, I always default to the earliest one, because your date of onset is when you start worrying about their contacts. Because before their date of onset, you don't need to worry about who they contact with. So I default to the earliest to make sure that you include anybody they may have had contact with when they were sick. It's the opposite for date of last contact. For date of last contact, you want to make sure it's as late as possible to make sure you're following them for the appropriate 21 days. So if there's a debate about the date of last contact, I always default within reason to the latest one. So you're making sure that you're following them as much as possible. Okay. So I'm going to go back to show contacts only. So those are your different options. In the show source cases, again, you can edit. The only thing you can do here, it automatically opens, is edit the link. You can't remove a source case. It doesn't have that unlink option here because you can't remove anybody from the contacts tab. You have to add and remove from the case tab. So if you want to if you want to unlink, you'd have to do that from the case tab. So you'd have to go back and find this case and then unlink their contact. Okay, so that's the all contacts tab. That's just for looking, basically. You have a wheel next to your contact name. This is, again, the options you can do things with for this contact. 1, delete contact. Same deal. Brings up, it says, are you sure? Asks you for a code. Then you've got convert to case. There's 2 different methods to convert contacts to a case. This is the lesser used one, probably. And it gives you a couple options. So you can, this is what I call manually converting a case to a contact to a case. Later you'll see we can actually enter daily information, and that links to conversions if needed. But I'll go through this one. So manually, you can click on the wheel next to a contact, say convert contact to case, which would only happen for a couple reasons. 1, they got sick and they were isolated. Let me make a note also. This application was built around the basis, which has happened in past outbreaks, that every case gets put into an isolation ward or an Ebola treatment unit. Right now, in a lot of these countries, that's not happening. Because like in Liberia, there is not the capacity, there's not enough space for all these cases. So use and isolated liberally. In the application sense, it's meant to indicate this person became a case. You may be in Liberia or somewhere else and have a contact that gets sick and is a case but was never isolated. You still need to say sick and isolated because that's what converts them to a case. Though remember, because again, this was modeled around the fact that if someone's a case, that they're put into isolation. If I click this, I say sick and isolated. It says, do I want to convert this contact to a case? I say yes, and it's going to say, okay, so tell me your date of isolation. Because again, this was based on previous outbreaks where you would have a date of isolation. You're going to have to do this if you manually convert someone, so you're going to have to remember to go back in and delete the isolation date from the record if this person wasn't in fact isolated. Just a side note. But this current outbreak is a little different from previous ones. So sick and isolated implies really sick and you became a case. We might change the wording eventually. So you can say sick and isolated. You can say died, in which case it's going to ask you for a date of death instead of a date of isolation. And you'll probably never need to use this one, especially in these outbreaks, not currently sick, but sick previously. It's possible to find a case after they've recovered, or pretty much after they've recovered, and you still want to have them as a case, but they're actually recovered and don't need to be in an isolation ward. And so this is a way, actually you might be able to do that instead of using sick and isolated to convert someone and have to worry about the isolation date. But anyways, don't really worry about that one. So if I did this, let's say I'm going to take SpongeBob, and I'm going to manually convert SpongeBob to a case. I'm going to say SpongeBob was sick and isolated. Wait, hold on, let me make sure I want to do SpongeBob. I'm actually going to do Ernie. Okay, so if you're following along, click on Ernie, click on the wheel, hover over convert to case, and then we're going to say sick and isolated. It says, do I want to convert this contact to a case? And I'm going to say yes, because Ernie got sick during his 21-day follow-up period. He meets the suspect case definition, or actually probable case definition, because he's got an epi link, and I'm going to say yes. And it's going to say, okay, what was the date of isolation? And we can say it's today, and I'm going to click OK. And it will tell me the selected contact was successfully converted to a case. So if you look, 2 things just happened. 1, 3 things happened. Ernie became gray. Ernie's sick, he's isolated, he's a case, you no longer need to follow him as a contact. So this indicates he's not going to be followed. Ernie's got the double exclamation mark indicating that he's in both records. And if I go back to the case tab, Ernie is now listed as a case. And there's no case ID because I need to go in and give him one. So I'm going to double click on Ernie's record. Very patiently wait for the application. It doesn't seem to like this computer very much. And I think he's number 7, DMS-007. And save. Oops, and it says you can't close without giving him an epi case classification. So he got sick, he meets the clinical criteria, he also has an epi link because he's got contact with a case, so he's a probable case. And then I'll save. So now Ernie is listed down here as a probable case with his double exclamation mark. Okay, back to contact. So that's how you manually convert a contact to a case, which you may to do. Okay. Now on to the fun part. So we're going to go to, well, before I do that, actually, everybody look up here. Oops. And so we were talking about contacts being active versus inactive. So let me go through. There's a lot of, this is where these slides will be helpful. A contact is activated for different reasons, and we'll go through all these scenarios. 1, an active, this is defining contact activation. An active contact is included in daily follow-up lists. We covered that. A contact is activated when a new contact is entered. You enter a contact, they're going to be active, they're going to be followed. A case is converted to a contact. We saw that earlier. We converted a case to a contact because they had exposure in an isolation ward. They tested negative. We need to follow them as a contact. They're going to be active. This is one of the complicated ones, and we'll get there. A contact is converted to a case because they got sick, and they're still in their 21-day follow-up period. We found them in their 21-day follow-up period. So we took a contact, they got sick, we converted them to a case. That case then tests negative, and they're still in their 21-day follow-up period. The computer will automatically reactivate them as a contact. So anytime you take someone who's listed as a case and a contact, and they test negative, the application is looking to see if they're still in their 21-day follow-up period. Because if they are, we still need to follow them out for the rest of the 21 days. They could get sick with something else. They might be sick with a cold now, and they could be sick with Ebola later. So the computer will see, they're still in their 21-day follow-up period. I'm going to reactivate them. We'll go through that in a minute. So that's when a contact is activated. Actually, let's do that right now. So we just converted Ernie to a case. So I'm going to go to the case tab. And Ernie's now a case. So right now, he's gray in the contacts tab, which means he's not being followed. I'm going to go to the case tab. And Ernie is definitely in back in the contacts tab. Ernie's date of last his date of last exposure is the 1st of September, so his date of last follow-up is the 22nd of September. So he's definitely still in his 21-day window. All of this, by the way, anything with dates, the computer interprets today as the date of the computer. This is important to remember, because if you're up late and you're entering data and it passes midnight, the computer changes to the next day, which can actually have an impact on stuff. So today is the system date of the computer. Okay, so we are still in our 21-day follow-up period. I'm going to go to the case management tab, and I'm going to click on Ernie. And remember, the way this happens is right now I've got Ernie listed as a probable. So let's say Ernie, who was in his 21-day follow-up period, got sick, got converted to a case, test negative. So I would put in his lab results as negative, and then I would come over here and I would change him from probable to not a case. So I say not a case, and I save. I say yes, and I go back to contacts, and Ernie's now white. The computer automatically saw that he tested negative and he's still in his 21-day follow-up period, and that he needs to continue to be followed for the rest of his 21 days. Any question about that? Okay. So back to the PowerPoint. So that's how you activate a contact. Contact is inactivated. An inactive contact is not included in the follow-up list, meaning they're not going to be followed that day by the contact tracing team or ever again unless they get reactivated, and they are gray. An inactive contact, as I said, will always have a final outcome, which we'll show you in a minute, because in order to be inactivated, they had to have a final outcome. So there's a couple ways a contact can get inactivated. A contact's inactivated when the first option, that dropped, and so in bold is going to be what that final outcome is, one of those three final outcomes we talked about before. If a contact is linked to a probable or suspect case that later tests negative and becomes not a case, and they're not linked to any other cases, or they're only linked to other cases that are not a case, they're going to be dropped from follow-up. So if a contact is linked to someone that then tests negative, and they're only linked to that person, they're going to be dropped from follow-up. So we can actually show this right now. We're in contacts. Let me find, so the way I'm going to find this is I'm going to look for someone who has only one source case. Okay, so SpongeBob. The only source case for SpongeBob is Neil, who's a suspect, okay? So right now SpongeBob is being followed. If I go in and Neil got tested, and he tested negative, and I therefore change his classification to not a case, and I save it, this would mean that, right, so Neil has a couple contacts. SpongeBob is only a contact of Neil. Neil's no longer a case. We do not care about his contacts because he never had Ebola. So if I go to contacts and I find SpongeBob, he should be inactive. He is. The computer automatically saw that he only had one source case that was Neil, and Neil is not a case. And so SpongeBob got inactivated. There's no reason to follow him. So like we said, anybody who's inactivated should have a final outcome. I'm going to double-click on SpongeBob. Is it working for anybody else? Double-click on SpongeBob if he's inactive, if anybody inactivated him. I promise it works. For some reason, this computer is doing very funny things. Okay. Took a while. SpongeBob's contact form opened. You look down at the bottom. Automatically, the drop from follow-up got checked because the computer saw that the reason he's inactive is he got dropped from follow-up. This becomes really important because this is a big item for analysis to see what's going on with contact tracing and see how the outbreak is progressing, how the contact tracing is going. It's a key analytic point. Okay. So that was the first one. Contact. Any questions about the first scenario where a contact gets inactivated where they don't need to be followed anymore? Okay. Second. Contact successfully finishes their 21-day follow-up period. I'll show you that in a minute. We haven't gotten to that part of the application yet. But basically, if I go into the application and indicate that the person was fine and healthy on their 21st day, they're going to get inactivated, and their final outcome is going to be discharged from follow-up because they successfully completed and were discharged from follow-up. A person gets sick. You saw one way to do that. We manually did it. There's another way where you put in for the day that they got sick. They're going to be listed as developed symptoms and isolated, in which case they don't need to be followed. They're a case. We can see them very easily. They're in the isolation unit. And this covers that last very unusual scenario I told you about where you're going to manually convert a contact to a case because you know that they were actually sick previously, and it puts them as drop from follow-up. Again, don't really worry about that one. That's really rare. So these are how a contact gets inactivated. And I'm going to go through the other two shortly, the other two scenarios. Any questions about what it means to be active, inactive, the general concept, anything like that? Okay. Okay, so we covered our All Contacts tab where we see all of our contacts. Now I'm going to go to my Daily Follow-Ups tab. Daily Follow-Ups tab. Again, Daily means today in the computer. So this is a list of everybody who on September 2nd needs to be followed. So it's only active contacts. If we go back here, we see that SpongeBob's inactive, and there's 6 contacts total. SpongeBob does not show up on your daily follow-ups tab, and there's only 5 contacts there because there's 5 active contacts in the system, and all of them happen to, at this point, have 21 days that includes today. So this is where you do 2 things. One, you can print out your list in the morning to give to the contact tracing teams and say this is who you need to go find. And 2, this is where you can then put in what they give you back at the end of the day to say how they did. So the process is they get printed lists in the morning, with contacts sorted by village of everybody they need to find for the day. And then they'll go out, do their contact tracing, mark what happened to the contact, and then give that back to you, and you need to put in what happened to each contact that day. So the form that they're going to get, there's a couple different versions. One is your daily report. So here I went and clicked on print daily report. So that's basically going to formulate a list of all the contacts that were in that list that need to be followed today, but by village. So if you remember, we have 3. So for Meredith, I didn't put in a village, so she's being listed as separate because it's the village list of contacts. We also had Atlanta. Kermit the Frog is in Atlanta. And then we had Sesame Street for Bert, Ernie, and Big Bird. And so it's now taken, and each of these will print out with there's an automatic page break when you print it. So there's going to be 1 sheet per village to print out. So that means you can hand, or if there's multiple sheets per village, they'll print in a row. You can hand all the Atlanta ones to one team and all the Sesame Street ones to another team. And what it's doing is basically saying, it says today's date. This is the follow-up list for today's date. It tells you, we'll look at one with a village. It tells you, it gives you a little key that I'll go over on how to fill out this form. And it says, and this is everybody for Atlanta. So if we were down here for Sesame Street, there'd be multiple lines for multiple people. So all of this, ID all the way through health facility, fills in automatically if there's a value in the database. So it's just taking what you've got in that contact form and putting it there. Phone number if you've got it, information so someone can actually find this contact. What's in this bold box, status and notes, is all that the contact tracing team needs to fill out. And in status, they just need to put 1 symbol. So if you look up here, this is the key. You're supposed to write a check if you saw the person and they're healthy, an X if you see them and they're sick, and a dash if you don't see them. So remember, there was a difference between a white box on the individual report and a gray one for not seen versus nothing. Not seen is a dash, nothing is somebody left this blank. So you're just going to go, and they talk to the contact, they see how they're doing. In some places you check a fever, and some you don't. And you'll do a check, X, or dash. The only complicated one is the X. So if you put an X, you can put that so the people going out and doing the contact tracing are not the people generally who are going to decide if someone needs to go into a treatment unit and be isolated. They're going to be the ones who raise the alarm and tell someone, you need to come look at this person, someone more medically trained, and decide if they meet the suspect case definition or probable case definition. So if there's an X, ideally they write why they put it there, what are the symptoms, and maybe if they already know, like what happened. Did they call someone? Did the person already get sent to a treatment unit? Things like that. Because again, you can have your yellow and your red. You're sick, but someone goes and assesses and decides they don't really meet the case definition, or you're sick and you definitely got isolated, or in a place where you can't get isolated, you meet the case definition. And so then at the end of the day, these are all the sheets that are going to come back to you from various teams. Questions about this printout? Okay. There's another format, which that one's a little easier to use, I think. And these have been based on sheets that were used. So in the past, this has all been done by hand, or maybe in Excel. So these are based on the sheets that have been developed and used in other countries before by hand. And in other countries, they have 2 options, a daily sheet or a 21-day sheet. So if I want to print, again, we're on the daily follow-ups tab. This is everybody who needs to be followed today. If I want to print it in a different format, I click Print 21-Day Report. So this is going to, it looks a little different. Again, it's, the date it's printed, the date printed instead of the date it's for, because you could theoretically use this for 21 days. You have the same code, like key and symbols. lists by village, and then one of these big boxes, it's not the friendliest looking thing right now, is for one person. So Big Bird is in Sesame Street. This is an area for notes. And then it's got here in the column headings, you list days 1 through 21. And what's listed here is the date of that actual day, because day 5 for these 3 different people is probably different. It's a different date for each person. This brings me to another note about EpiInfo and dates. EpiInfo, because there's different date formats. Here we do month, day, year. In most of Africa, they do day, month, year. Whatever your computer is set as is what EpiInfo is going to do. So you know in the forms, it prompts you. If you actually see a date, it'll actually prompt day, month, year. That's because this computer's date format is in day, month, year. If I changed that, or if I were on a computer from Uganda that was in, sorry, month, day, year is here. If I were in Uganda and the computer's set to do day, month, year, that's what will read on the form, and I believe that's what's actually going to print out here, the order of the numbers. So be very conscious of what your computer is set as. So here you can go, and you would have to find the date for today, so September 2nd for Big Bird, and put your mark there. You see down here, actually, oh, ignore that right now. He shouldn't have printed out. Once you do go in and put in information, you're actually going to see a pre-populated list of checks, X's, and dashes. So whatever you've put into the system, if you print a 21-day sheet and then you add some context and you need to print it again in a couple days, you'll still be able to see what happened on all the previous days. So some teams like this, where they actually like to be able to see what's happened. Another way to use this, even if you're using the daily format sheets for the contact tracing, this is a really good way for like the contact tracing manager to go back and see which contacts they've missed for a few days. If you want to print everybody and just go see like who's been missed for the past couple days, who do we really need to focus on. It's a good way to see the progress of the contact tracing. Okay, any questions about the 21-day format? Okay, so that was your daily follow-up. So this is who needs to be followed today. You print it out, give it to them in the morning, they fill it out, they bring it back. And then look here. So this is where you're going to put, it's your status and your notes. Again, this is all filled in. So you've got a check, an X, a dash, an NR, which is short for not recorded. Because if you're really focused on data, it's nice to actually indicate the difference between not recorded and recorded as not seen. So if you have a check, you put a check. If you have an X, you put an X. Dash, you put a dash. And if it's blank, you put not recorded. So let's just say today we went through and we saw Meredith, and we saw Kermit, and Bert. We didn't see Ernie. That's the dash. And then Big Bird, we saw, but Big Bird was sick. So I'm going to click the X. And then this other question pops up. If I click an X, it says isolated, yes, no. Again, in historical context, isolated is synonymous with you're a case. Now might not be the same. So this really should say, for these outbreaks, meets case definition or something like that. So treat it as such. If you click yes, you're going to convert them to a case. If you click no, you're not going to convert them to a case. That's basically what you have to know. So I would click no if, I could say no, and I could put a note, runny nose and headache. That's what was written, which doesn't necessarily mean you have to go into a treatment unit. Or I could say yes, in which case it's going to ask me. You just clicked yes. Clicking yes for sick means you're going to convert them to a case. So I'm going to say yes just to show you. Do you wish to convert this contact to a case? Yeah, Big Bird sick meets the case definition. I'm going to say yes. The contact's been converted. I didn't need to put in date of isolation because it's going to take today's date and say today was the day that Big Bird got sick and was isolated. So I click OK. So you notice already automatically Big Bird's not on today's follow-ups because Big Bird's inactive now. If you go back to your All Contacts tab, you've got Big Bird is inactive, is gray, has the double exclamation mark, which means there's a case record too. I go back to cases, and Big Bird's a case now. And then normally I would just go in, add a case ID, and fill in. So just FYI, when all this is happening, basically if I opened up Big Bird's record, all the information that was in the contacts form is there, and you're just going to have to go, someone's going to have to go investigate Big Bird, fill out a whole case investigation form, and fill in the rest of the information. But name, gender, things like that are already there. Same for case to contact. If you convert a case to a contact, any of the fields in that contact form that have a synonymous field in the case form are going to be pre-filled. So then you just double-click and enter whatever's left. So that was, we've done 1, which is a contact inactivated when their case tests negative, or 3, contact developed symptoms and isolated. So that's what we just did. So now if we go back and click on Big Bird, there's a check automatically in developed symptoms and isolated or died as the outcome for the contact. What is this one? Okay, so that's basically, that's the daily follow-ups tab. You print out and you put back in information. Any questions about that process? Okay. Yes?
The daily follow-ups, so when you're on this account, and let's say it's 12:02 a.m.
I'm about to get there. You're like always a step just ahead of me. Okay. So that's what the prior follow-ups tab is for, sub-tab. So if it's 12:02 and I'm entering information, so really I need to enter yesterday's information. Or if I get a contact tracing sheet that comes to me 5 days after it was filled out, I still want to be able to enter the information. I go to prior follow-ups, and I go and I pick a date. So this goes 1 day forward, 20 days back as you could possibly want. The 1 day forward is, what if it's today and I want to print tomorrow's list ahead of time? So I can go to tomorrow, the 3rd, and the only option here is to print the daily version, not the 21-day version, but I can print the daily version because remember it prints with the date for that, and also some information changes based on the day. And so if I want to print tomorrow's, so it's ready ahead of time, I leave it tonight when I leave. The contact tracing teams leave at 7 in the morning, and I don't want to be there at 7 in the morning to give it to them. I pick tomorrow's date. Then there's the other scenarios where what if I need to enter for a day that's before today? So let's say I got a sheet for today. One lonely sheet came in from August 29th. Meredith, the only contact who was active on August 29th, needed to be followed up. I think the others hadn't become contacts yet. And so you just take the same. You fill out the information and the appropriate actions taken by the computer. Any questions about that? So you can go to any day. Or if you need to edit information, you get new information, you can go to that day and edit it. And this is how I'm going to, how do I cheat and show this? 1 second. So if today is September 2, 1, 2, 3, 12. Sorry. Give me 1 second to prep something. Okay, so I just went back in time and I gave Neil a contact that had contact with him 21 days ago, so I can demonstrate something. So remember, or I thought I did 21 days ago. Oh yes, I did. Okay. So back to here, we've done how you inactivate a contact. We've done 1, we've done 3, we haven't done number 2 yet. So number 2 is a contact successfully finishes their 21st day of follow-up and they're discharged for follow-up. So there's a special slide just for what happens on the 21st day. So there's a lot of different things you could put for their 21st day, obviously, and so these are the things that happen. If you mark that someone is seen and healthy, which is a check, they're going to be discharged. They're going to be an activated discharge from follow-up. That's it. We don't need to follow them anymore unless they have contact again with somebody. If you put seen and sick, so the X, but they're not isolated, so when it asks you that question, are they isolated, or in this case, are they a case, and you say no, they're going to be inactive and discharged because if they're not sick with symptoms of Ebola on their 21st day, they're good to go. If you say seen and sick and they're isolated, they're a case, they're going to get converted to a case just like any other day. If you say someone is not seen or no information was recorded, that contact is going to remain active. Or if you say seen and sick but you don't know if they were a case or not, they're going to remain active. So this is also a different mindset than previous contact tracing efforts in the field. When contact tracing was done just by hand or in Excel, people only followed contacts within their 21st day, which meant that if a contact wasn't seen for all 21 of their days, they still didn't follow them after that. But you don't know if that person was actually sick or not. So this is one way of trying to kind of force people to say, oh, we actually really don't know if they're okay. We still need to try and find them. Or if you saw them, days 1 through 18 and you didn't see them the last 3 days, we still need to find them on day 22, 23, 24, however long it takes to find them and see not how are they then, but how were they on their 21st day or those last few days? Because if you find them on day 40, hopefully you don't have to deal with this, they could have gotten sick and recovered since then. So you really want to see how they were on their 21st day. So, if I go to today, I should see that, oh, I did this wrong. Sorry, give me 1 second. So what I tried to do was give Neil a contact whose last day was today, but then I forgot that I used an existing contact, and so it took their latest date of last contact and made that their basis for their 21-day follow-up period, which means that today is not their last day because Neil was their earliest exposure. Did that make sense? I didn't say that very well. But I basically added a source case they had before the source case they already had listed, so it didn't impact at all their follow-up period. So I'm going to take Neil and add a new contact to him and try again to cheat the system. Now I'm really being boring, AB. And say save and make their date of last contact August 12th. So if I go to contacts today, refresh, contact AB is there, source case is Neil, and the date of last follow-up is September 2nd because I put in their date of last contact as 3 weeks ago, okay? So then if I go to my daily follow-ups page, we've entered information for everybody else before, but we didn't have contact AB on there. So if I click check, they're going to be discharged from follow-up. If I click X and I click they were sick, they're going to be converted to a case and have a final outcome of sick and isolated. If I click dash, they're going to stay active. If I click not recorded, they're going to stay active. So I don't have to enter a lot of contacts. Let's just pretend I hit, well, hold on 1 second, sorry. I give Neil CD as well as a contact, so you can see the different ones. C. So I'm going to give him another contact who had contact with him 21 days ago. Okay. Okay, so Neil has 2 contacts that I only have contact with him that had contact with him 21 days ago. So if I go, and let's say we saw CD today and CD was fine. So I'm going to click check. And then I'm going to go back to my all contacts list and look for CD, and CD was just inactivated, right? There's no double exclamation mark this time because CD never became a case. It just went through all 21 days and was fine. If I click on Show Individual Report, you can see that there's a green box for today. That's the only day we put in information. If I went to, if I had done it before, so once someone is inactive, you can't find them on prior follow-ups. If you're searching in prior follow-ups for them, they're no longer in the system. If I had gone before I inactivated CD and went to a previous date, I could have put in information. So CD is inactive, was seen on the 21st day. If we go in to the record, CD automatically has an outcome of discharge from follow-up. Let's go to daily follow-ups again. So let's say that we already saw what happens if you make someone sick. We converted someone that way before. So let's say we did not see AB today. So I'm going to click the dash. The same thing would happen if I clicked NR. The same thing would happen if I clicked an X and said that they, nope, it wouldn't, sorry. If I click NR or dash, they're going to end up staying active. So I just clicked on the 21st day for AB that he or she was not seen. And so AB is still active. And now I'm going to show you tomorrow's list, because technically today was the 21st day for AB. If I go and print the list for tomorrow, which would be the 22nd day for AB, You don't see AB here. The computer can't handle that because this is where we put in information. So if we had someone who was past their 21st day here and we put in information, the computer would get a little confused because it's reading the system date. However, if I go and I print the daily report, remember this is tomorrow, so the 22nd day for AB, AB is listed here as someone who needs to be followed. And there's supposed to be there should be a star right next to AB's name, which may have changed because it looks like the print option just changed. So we'll fix that. But there should be a star next to AB's name. The star indicates there's a little key down here you probably can't read that says star. Contact is past 21st day of follow-up but was not seen on the 21st day. Please check on what the contact's health status was on their 21st day. So basically, long story short, anybody who has not been cleared on their 21st day is going to continue to print out in the follow-up report to try and force you to keep trying to find them. So let's say and the star just tells the contact tracing team why they're still there. So let's say we actually find AB today, which is day 22. I mean tomorrow, which is day 22, and we want to, and AB was fine. I'm going to have to go back to AB's 21st day. And I know AB's 21st day was the 2nd. I can find that out by going to the all contacts list, looking at AB, and seeing the date of last follow-up is listed here as the 2nd. So I go to the prior follow-ups page. Even though we found AB today, we're going to go back to the 2nd. And it's going to make me a liar. Which is today, I guess. So we're going to go to today, or it would be a prior day. It probably doesn't like it because it's not actually a prior day. And I'm going to change, or if this were tomorrow, it would be blank. I would put a check. I would say, okay, we saw AB, and I would put in here, we found AB on their 22nd day. And then I would go back to contacts, and AB is now inactivated. So basically, again, sorry, that was a little discombobulated. In summary, if you're not seen on your 21st day, you're going to stay. You won't show up on your the daily list in the computer, but you will show up on the printout with a star next to your name to indicate to the team that you're past your 21st day. We still need to find you. And if you find that person, you just go back to what their 21st day was to put in the information to get out of the system. This is important actually to know because, for example, when we arrived in Liberia, there was a big backlog not only of case forms and contact listing forms, but also their hard copy, because they were doing contact tracing by hand, contact follow-up forms. And a lot of those contacts had already been entered in the system, but they hadn't put in the contact follow-up forms. So in order to catch the database up to a point where we could use it, we actually had to go through and inactivate all the contacts. So we would take the sheet, find their 21st day, and inactivate them. Okay, so that's your contacts tab. That's pretty much everything for contacts. Let me make sure we covered everything. I think we did. So any questions about contacts in general, inactivation, activation, different scenarios, anything at all?
What if someone was taken off the follow-up list by mistake and you need to put them back on? Is there an easy way to navigate that?
You mean in terms of, if they were inactivated?
Yes.
So there is a way to do it, but if you encounter that situation in the field, basically that gets to the point where you would want to email the EpiInfo team and have them do it for you. So, or we can tell you how to do it. So there's a way to basically get around the system, but not something that you can do. Well, you can do it in the field if we tell you how. And I'll leave it at that. There's basically a super user mode for this application that's meant to be used by people who are familiar with every single aspect of it, that can allow you to kind of bypass some things. So there is a way to do it, yes.
Thank you.
Mm-hmm. Any other questions? Okay, so the rest will be really fast. Isolated patient, so that's basically everything for contact tracing. Your isolated patient, actually there's one thing that I've never actually seen, but theoretically you can export your daily contact tracing list to Excel. So let's see. we're experimenting together. Okay, so something that's coming up in the field right now is, right now, the way the contacts sort is it sorts by village, and then after that by district or sub-county district, whatever the larger location areas are. So you actually have to have all three line up, but it automatically sorts by village. Some places want to sort by something else. And so again, on the to-do list, hopefully the sooner rather than later to-do list is to make it so you can pick what you sort by. Village, district, sub-county, whatever it is. As a quick fix until we get there, what we did is you can now export your daily list to Excel. So it doesn't do the pretty format that you hand to the teams, but it does print out all the this was on the daily follow-ups tab. It will print all the contacts that you need to follow today. And this makes it so that, I mean, basically you could still have someone take this list around and do checks, X's, and dashes. But you can now sort, just like you would in Excel, by any of the columns here. Yes? Mm-hmm. So, yeah. So you just hit, there was something and it got taken out. There have been a lot of aspects of this that have been highly debated. We've gotten feedback on the application from different ministries and MSF and WHO and things like that. There was, and we may end up adding it back in if it's something that people want enough. Yeah, so there was a way basically on that contact form where you could put risk as low, medium, or high. And we were actually, one of the debates when that existed was, do you want to have someone manually fill it in? Or you could have it automatically calculated based on off the types of contacts that are filled in. So it did exist. It's pretty easy to put in. Enough people said they didn't want it there that it went away, but this is one of those things that goes back and forth. Honestly, right now, the contact tracing volume is so big that no one would be using it. So I don't think it's a big deal for this outbreak, because right now it's a matter of can we contact trace or not even so much things like that. Yeah, I mean, this is something, again, it's one of those things that's been debated a lot of different ways. If enough people are asking for it, we can add it back in. Yeah. Right. Right. So this is a good demonstration of why this was a highly debated topic. So if you take that conversation, turn it into an hour, and then apply that to almost every single thing in the application, that's the process we've gone through. So thank you for demonstrating. So if you're out in the field, be very nice to us poor folks at EpiInfo and realize that every single thing is being debated like this and that every country has a different opinion about everything. Okay, so isolated patients. Let's move on from contact tracing. So this is pretty simple. It's doing a calculation. There's 3 dates it's calculating based on, it's calculating off of to see who's technically in isolation or Ebola treatment unit. It's looking at everybody, and so there's dates in the form for hospitalization and isolation, and you need the isolation dates to be filled out. Often they're the same, sometimes they're not. So it's looking at who has a date of admission to isolation, who does not have either a date of discharge from isolation or a date of death. So if you've been admitted and you haven't been discharged or you haven't died, you should theoretically be in isolation. So this is only useful if the data flow to you from the Ebola treatment unit is up to date on a daily basis, and if you're getting complete information. When I was in Guinea in April, we actually were able to keep this going, and it is very handy just to have a grasp on who, how many people are in the treatment units. You think it might be a simple thing to get a hold on, but it's not. You don't always have good communication with the treatment units all over the country. So if you can keep it up to date, great. If you can't, then just don't use the tab. It's also another good way we would use in Guinea before, you do a lot of data entry in the morning maybe to get ready for putting out a sit rep in the late morning, early afternoon. This is a good way to check that you've actually entered everything correctly, because in that scenario, we had 2 treatment units, one in Gekadu, one in Conakry. We actually had lists of who we thought, based on information coming in, who should be there. So it was a good way to cross-check we'd put in everything correctly. So you can use it for different things. The other thing about this is if you're in one location where you're near a treatment unit, again, we have this patient outcome form, but right now we can't rely on that. People, they don't have time to fill it out. And so there's different ways to get information from your treatment units. One would be if they're sending you something like an Excel list every day. In Gekadu, there was a brilliant way someone was doing it. They just had everybody listed, and then in rows on an Excel sheet, and by column they had the dates. And then they had a color code for what was happening to that person. One color was they're in isolation. Another one was they died. Another one was they got discharged. So you could just look down a date and see what happened. That isn't usually displayed for you quite as nicely. So if you're not getting that information from the treatment unit, something we've done in almost every outbreak I've been in, if you are near a treatment unit, is for the place that your database is near, you can go and we used to just do this in notebooks, is we would sit and we'd list, okay, this is everybody who was in the treatment center yesterday, and you go to the treatment center in the morning or at the end of the day and say, okay, who got discharged, who died, who's still here, anything, who got admitted. And so basically, if your list of isolated patients is up to date, you can basically print out what we were doing in our notebooks, which is it prints out basic information about the cases, and it asks a couple questions. Did you collect a sample today? You may or may not care about that. Were they discharged? If so, the date. Did they die? If so, the date. And then anybody who's been admitted, you can just write the very basic information on the bottom. This is also helpful if you're not getting case report forms completed in a timely fashion. If you're doing these visits, or theoretically you could even do a phone check with this form as a guide, you can find out at least the name and age and gender and maybe date of onset of any new admits. And that's at least something to get into the database. So this form is just, you take this back. There's not a place to enter this. It's not an interactive tab, the isolation tab, but you would basically go into this record. You can double-click into a record from here and enter that information. So that's the isolated patients tab. It's simple. You can use it. You can ignore it. Yes?
So if we wanted to convert a contact to a case,
Yeah.
we're supposed to say that they were isolated even if they weren't isolated.
Right now, the way the application is, yeah.
So then is that tab even useful? Because it could potentially hold the names of
So
a
if
lot
you're
of people
doing
who
that-
aren't even in treatment.
If you're doing that, keep in mind now, that's why I said for the application as it stands, if you're in a country where all the cases are not getting isolated, I think Guinea they are, Liberia they're not. If you're in Liberia, remember that if you convert and say isolated, you should go in and delete the isolation date.
And
If
that
you do
will
that,
remove
this will
them?
still be useful. Then they will not be in this
Okay.
list. Yeah, it's all based on the date of isolation and the date of discharge or death.
Okay.
Yeah. So if you know how it's calculated, which you do now, then you can use it. Any other questions before I go on to analysis? Okay. Analysis. So this is one of the things, reworking this a bit is definitely on the high end of the priority list. Right now, so you've got a couple different things. You've got what we call the canned analysis. So when we made this application, initially went through and looked at sit reps from a bunch of different countries, from different outbreaks, and said, what are the things people generally want in their sit rep? And let's calculate that, automatically in real time, so no one has to do it. So there's a bunch of tables in here and some graphs. This is our epi curve right now. And information that people would generally want. So keep in mind, take this with a grain of salt in terms of you have to know the quality of your data and what you've put in to know how good this automatic analysis is. So no matter what, this top table will be good. So the top part is a summary of all patients. So you're looking at everything. So here it's just a table of what's your epi case classification, confirmed, probable, suspect, not a case. Again, excluded is not included anywhere in here. Your total count, onset before or after outbreak detection, sometimes places want that. How many confirms are alive? How many are dead? How many are currently in isolation? So you have to know if your isolation tab is actually useful. If you know that you're not getting the dates to work that out, know that you shouldn't use your currently in isolation numbers. So again, just know what data you have and how good it is to know what parts of this analysis you can use. Because the computer doesn't know if you're backlogged or not up to date or anything like that. It's just going to analyze what is in the system. Lab classification. This is usually helpful if you're entering all your lab results, the number of patients tested, number of samples collected. This table, yesterday's and today's statistics, is pretty much what I would not use right now because I don't think in any of these countries are we getting reliable enough data. For example, your new suspect probable confirmed cases identified today is based on the date the date the case was reported. I think about 98% of the time no one's filling that in. So if you know that you can't use this table. And this was something that had to get emphasized when doing sit reps. You know, some things, the new cases today, the new deaths today, it's honestly better done by hand, based on the quality of the data that's going on. So you really need to be able to keep track of what's been entered for the day. Let's see. This will be automatically calculated. These two dates, date the last case was admitted to isolation, date that the last case was discharged from isolation or died. Depending on the country, those are the dates they're going to use to determine the end of the outbreak. I don't think we're anywhere near that, so don't worry about that. But it's usually the end of the outbreak is 42 days, either after the last date of admission to isolation or the last date of discharge or death from isolation, depending on who's running the show. This will be an epi curve for confirmed probable suspect. You can, anything here, you can kind of, there's a way to print this, and once you print it to a PDF, you can do like snapshots and paste them in PowerPoint presentations and things like that. The bottom part, so again, like I said before, and for these epi curves, important to note, at the bottom it will tell you how many cases don't have a date of onset and thus are not included in the epi curve. So the rest is for confirmed and probable cases only. Again, in previous outbreaks, those were the ones we really cared about because we knew enough information to know that a suspect was really just a suspect and a probable really was a probable. And so most analysis was done for confirmed and probables. Right now, again, there's just not enough information coming in, and so really you need your analysis to be for confirmed probable suspect. So one of the things I'm hoping to do is now create this more detailed analysis for all three. Hopefully that will come soon, but there's a way to do that now even if I haven't done it for you. So this is EpiCurve is a much more detailed information, location, symptoms, age, things like that. The bottom is the summary of contacts. If you are running contact tracing out of this application, this will be incredibly useful, and this is pretty much up to date as long as you're putting your information in every day. And this will be in every single sit rep that needs to be put together. It will tell you at the bottom, it says the total contacts listed. That is how many contacts are in your contact list, active, inactive, no matter what, how many have been listed. Then contacts currently under follow-up is your active contacts. And the top three are what happened to all the difference, the ones that are no longer active. How many discharged successfully, how many developed symptoms and were isolated, or in this case became cases, and how many were dropped from follow-up. And all this information people really want to know. It will also calculate for you the number of contacts and the percent followed today. So we put in information for 3 contacts. I think that's calculating 3 because it's only calculating out of the currently active contacts. It's not counting the ones that were inactivated. It does not give, it also calculates how many contacts were followed yesterday and the day before. It does not give you a percentage on purpose because what they want reported is the percentage of contacts followed, because the number of active, the denominator for this is your active contacts. And so it's going to be saying how many active contacts were followed yesterday, but the number of active contacts today and yesterday are different. So you're going to have to look at your sit rep from yesterday, see how many active contacts you had yesterday, and use that as your denominator. But this table will help you a lot. So that's your canned analysis. Again, know your data before using it because that will tell you what's reliable and what's not. Something that will be pretty much, as long as you've got your epi case classifications and your final outcomes up to date, this is going to be your biggest help, your district report, which is going to give me nothing because I do not have any countries. One second. So know that for that to work, you have to have countries listed in all of your cases. Oh, I didn't. So I'm just going to add countries to 2 places. And we'll say that Doug is in Atlanta. And which is in, well, we'll still say it's Uganda since we're in Uganda. Anyways, it doesn't have to be realistic. So, yeah, that's important to note. For certain things, you have to list a country, especially important now because you'll have cases from different countries in one country. For this analysis district report to work, you have to have country listed. And district is meant to be synonymous with kind of the big geographic area within a country. It would be the same as state here. Here we list case counts by state. In Uganda, it's district. In Liberia, it's county. In all these countries, we have different variables listed based on the country. So this would basically be the equivalent of a state report right here. And the only country I have listed is Uganda. So it's going to give you a list of your countries. Because even if this is an outbreak in Uganda, you might have cases from different countries. It's going to say what date and time is this report valid for. Data gets really touchy in outbreaks, and people get really worked up even about slight number changes. So it got to the point where we said anytime there's a printout, we want a date and time stamp for when it's valid for, because printouts get left around, media finds them, people start getting upset because the case count's wrong, and you want a date and time stamp on it. So make sure you do it for when it's valid for, not for when you're printing it for. And then it will give you a table. So for it will actually give you, let me show you this in a different outbreak. Okay, district report. There's only one country, Norland. And there's all these different districts, fictitious districts in Norland. So what it does is the first table is country-wide. For the country you selected, it's telling you your case count, who's dead or alive, and who doesn't have a known status, which means there's nothing filled out for dead or alive. So this is going to be, again, one of the basic things you use for your sit rep, because this is the main thing they want to know, the case counts, who's alive, who's dead, and what's the case classification. The first table is the country. The rest of the tables are all those district-level case counts. And again, it's got a date timestamp. So, and this was actually formatted, Guinea wanted it in this format, and you can use it all over. It's actually a format you could print out and use if you wanted. You can print and save all of these documents. Okay, so what if there's something that you want that's, we know there's work that needs to be done on the canned analysis. There's something we want that's not in the district report. You just want it once. If you go and you click free-form analysis, left click once, it's going to ask you, basically what this is going to do is it's going to take data that's here and load it in regular EpiInfo 7. And so if you're used to using an EpiInfo 7 dashboard, you can put whatever data you want here into the EpiInfo 7 dashboard and do whatever you want with it. So it's going to ask you, what data do you want to load in? Cases, confirmed and probable, cases, confirmed, probable suspect, all patients, which would do your not a cases, your excluded. I don't think it does your excluded. It just does not a cases, and contacts. So I'm going to say, analyze cases, confirm probable suspect. It's now opening just normal EpiInfo 7 in a dashboard, and it tells me up here I've got 220 records loaded, which means I've got 220 confirmed probables or suspects. And even if you look over here, I don't know how familiar people are with EpiInfo 7. This is telling you Epi case classification of 1, 2, and 3 are what's filtered on for which is confirmed probable suspect, and you can do whatever you want. So if I wanted to do a frequency of gender, and so if you're good with EpiInfo 7 analysis, great. If not, that's a whole nother course. Gender. Though it's actually, if you play around with it, even if you haven't used it, if you play around with it, it's just a lot of right-clicking. You go to Add Analysis Gadget, and you can choose what you want to do. It's actually pretty intuitive to play around with. So I'm going to do a frequency of gender, advanced options. I want to stratify by epi case definition. And I click Run, and so now I can look at gender. 1 is male, 2 is female. There's a way you can, again, it depends on how well you know how to use this, but